Welcome to the Hills Health Next Summit. Please take your seats. The program will begin in 5 minutes. Welcome to the Hills Health Next Summit. Please take your seats. The program is about to begin.
Trusted, credible, nonpartisan. The Hill's unbiased news and analysis on policy and politics is delivered straight to the halls of Congress with unparalleled engagement in the Beltway and beyond, amid a conservative vow to make America healthy again and the rapid loss of funding for public health programs and research. From enterprise reporting to breaking news to live events, The Hill stays on the pulse of what's next in health. Welcome to the Hill's Health Next Summit.
Please welcome Bill Salmon, SVP of Editorial Content at The Hill.
Thank you so much. They usually have me stand in front of the stage because of my height, but I guess the camera angles are going to work out today. Thank you for coming today. My name is Bill Salmon. Welcome to the Hill's Health Next Summit. I am the Senior Vice President of Editorial Content at The Hill, and I'm so delighted that you're here today. You know, this may be day 7 of the government shutdown, but I'm here to tell you that the Hill never shuts down. And from the looks of this crowd, it looks like you aren't feeling particularly shut down today. I think some of you look maybe a little fired up, although others may be waiting for the coffee to kick in. I just want to welcome everybody in the room and also everybody watching on our live stream. In fact, if you're following along social media conversation, you can use the hashtag #TheHillHealth. It is actually nice to see some familiar faces in the crowd that I actually remember seeing at our last Health Next Summit, which we held back in March. And it strikes me how much has changed in that short interval when it comes to healthcare. If you think about it, those campaign promises we were all talking about have now sharpened into actual policy proposals. Those freshly minted agency leaders are now implementing sweeping changes. And meanwhile, the usual torrent of healthcare, global healthcare changes are continuing apace, and that sort of is redefining the very essence of patient access and care. And to complicate all of that, of course, as so often happens in Washington, policy gets derailed by politics. And of course, in this case, the government shutdown, right? Which, by the way, hinges in no small part on the healthcare debate, which we're going to be getting into today and which is playing out across the country as well. I do want to take a moment to thank our sponsors, By Heart and Susan G. Komen for the Cure, for their generous support in making today's program possible. I also want to note that in a government shutdown, it's perfectly normal for some government officials to occasionally cancel some of their speaking engagements. So it's possible that may slightly impact our program today, but fear not, because we have convened the very top voices in healthcare, including some from the private sector, who are going to assess a lot of stuff today, not least of which the Medicaid and Medicare reform issue, which is kind of a big one, women's health, mental health, and the most promising advances in AI and healthcare technology in all of clinical care. So without further ado, let's kick off today's program with a panel of journalists, not just from The Hill, but also from News Nation, which is The Hill's sister journalistic outlet. They're going to get into discussing the sticking points in the healthcare debate, which, of course, some say is the very reason that the government has shut down in the first place. So again, thank you again so much for coming today and being a part of this very important conversation. Thank you.
Please welcome to the stage Bree Jackson, Deputy DC Bureau Chief for News Nation, Joseph Choi, Healthcare Reporter at The Hill, Emily Brooks, Congressional Reporter at The Hill, and Julia Manchester, National Political Reporter at The Hill.
Good morning, everyone. Thank you so much for joining us today on day 7 of the government shutdown. We want to get everyone up to speed about where things are. Last night, we saw that 2 stopgap measures in the House failed again to reopen the government. I believe the Senate's going to be voting later today on another measure. So we want to get you all up to date with just some clips of lawmakers that we've compiled talking about the current state of affairs. Take a look.
We're stuck in a shutdown mess of Democrats' making. And the American people are suffering as a result. Mr. President, Republicans remain united around a clean, nonpartisan funding extension. It's passed the House of Representatives, and it's currently sitting right here in the Senate, ready to be voted on. It has no new Republican policies, no partisan policy riders. It's straightforward, simple, and clean.
The government remains closed because Donald Trump and Republicans insist on raising Americans' health care premiums and kicking millions off their insurance. Sending premiums skyrocketing, as Republicans insist, is fundamentally unsustainable. The American people overwhelmingly support affordable health care.
What we passed in the House 2 weeks ago is a simple continuing resolution. It's exactly the status quo. These are Biden-era policies and spending that our Democrat friends actually put into law. We're just asking them to extend it for 7 more weeks so the Republicans and Democrats can work together to figure out the new appropriations bills. That's all we're asking.
We're in the midst of a government shutdown that has been caused by Donald Trump and Republicans to inflict further pain on the American people. The government is shut down right now because Donald Trump and Republicans refuse to provide health care to working class Americans.
So
as you've heard us say several times, we're in the middle of day 7 of the government shutdown. And at the center of this is healthcare. You heard Schumer say it, you heard Jeffrey say it. At the center of this is healthcare. Now, this is an issue that many Americans are trying to understand. And so, Joseph, this first question goes to you. Talk with me about this. At the center of this shutdown is healthcare for Americans being stripped away by President Trump's big, beautiful bill. Is this a correct assessment of this?
On some level, yes, but Democrats are certainly framing this as a way to kind of ameliorate or undo some of the impacts of the OBBBA by extending these ACA tax premiums because Medicaid restrictions were added through the OBBBA. I think they view this as a way to sort of lessen the impact of that by ensuring that people can still access affordable plans. Remember, through these premiums, a lot of low-income families can access $0 premium plans. And so that's significant. And estimates indicate that maybe 22 out of 24 million recipients of these plans are receiving them thanks to these tax subsidies. So it's a very, saying we support affordable healthcare is like saying puppies are cute. It's a very popular and it's a very easy issue to say. There obviously falls down to the nitty-gritty of things, but essentially, it comes down to they failed to, they didn't really have a choice, but they couldn't stop the passage of the OBBA, but through this, they can possibly lessen the impact of what was passed.
Emily, you cover House Republicans and the conservative movement very closely. She actually writes a newsletter of the movement. Very good. You should all subscribe.
Thanks for that.
Yes, needed to fit that in. But we're hearing Republicans and conservatives, led by President Trump, claim that this is about, the impasse is over Democrats trying to give illegal immigrants health care. Is that claim true? And what is the latest conversation on Capitol Hill surrounding that claim?
Yeah, this is, without getting too much into the weeds, what Republicans are saying is they're referring to things in the Democratic framework that would strip out things from the OBBA that would restrict healthcare access to migrants that might have some legal status, but Republicans say they shouldn't have legal status. There's also things about Medicaid reimbursement. So it gets very in the weeds, but getting into those weeds is kind of what Republicans want that to happen. Of course, Democrats at the central argument of what they're talking about, it's not that we really want to give illegal immigrants health care, and that's why we shut down the government. They're talking about these expiring Affordable Care Act enhanced tax credits at the end of the year. They're talking about other OBBA things that are affecting the price of health care. So, that was really the message we were hearing a lot from Republicans last week, that argument, but there was a little bit of a shift in yesterday's press conference with Speaker Johnson in the Capitol, and he was starting to say, Republicans are the one who care about affordable care. We're the ones who want health care. So not as much yesterday about that talking point, so we'll see if that continues. But because this is really being framed around health care, I think the Republicans are trying to take hold of that a little bit.
Yeah, and I did notice that in talking to Democrats. I mean, they seem to think they're on firmer ground because they've been successful on healthcare messaging, particularly going into midterms. I can think of the 2018 midterm elections where we saw a blue wave, and also 2006 during the Bush administration. I mean, do you think there's when talking to Democrats in that world, do you think they feel that they're on sturdier ground there?
I think they definitely want to make this about healthcare, right? This is a big issue for Democrats. It's a top issue for Democrats, and it's one that Republicans have honestly struggled with for years, ever since, they were trying to repeal the Affordable Care Act and then failed to do so, and then they have, this issue, and it's much firmer ground for Democrats, and they really think that once those notices about how much premiums are going to increase start going out, and people keep on seeing that, because of those expiring tax credits, that they will be, that will help their argument that they're making in this shutdown fight and get Republicans to come to the table to negotiate on extending those Affordable Care Act tax credits. But of course, Republicans say you have to open the government before we do that. What's interesting, though, is that they are not completely shutting down the idea of maybe negotiating some reforms to the tax credits and extending them. I think that that is a pretty difficult political lift and really complicated to get all of the Republicans needed to okay that in a way that Republican leadership, frankly, can withstand politically, because there are a fair number of really hardline conservatives saying, just let them expire, don't extend the tax credits. And we're hearing that from some outside sources as well. So that's, how many Republicans in the House GOP conference really think that? I think a lot of them would like to see them expire, but might be okay with extending them with some adjustments and reforms. But exactly what those look like, we're nowhere near close to looking to knowing what that could look like.
And Emily and Joseph, I'm curious about this, because we talked about the messaging and that both sides are sticking to their message on this. How do you think that's resonating with your everyday American that's not here in this room, someone that's not really into the medical field or understanding of it? How are these messages resonating with people at home? Do they understand the heart of this issue?
Yeah, well, I think that it depends on kind of the wording of the poll and what you look at. I don't have the numbers off the top of my head, but when you look at like who's getting the blame for the shutdown right now, it's primarily Republicans. But when you ask, what should Democrats refuse to fund the government unless they get like the policy reforms that they want, people, even Democratic voters mostly say no, they shouldn't. Independents and of course Republicans are much lower. So that's the tricky political calculation, and that's why we're seeing all of these press conferences every single day from all of the leaders in both parties, really pushing their message, doing so many media interviews. Each side is really trying to take control of the narrative here.
And to add on to that, I do have some numbers recently because we got I'm cheating because we just got a really great poll from KFF, the health policy nonprofit here in DC, and somewhere around 70% of voters say they would blame Republicans in Congress or President Trump for this shutdown and healthcare, becoming more expensive, and they said I think only around 22% said the same about Democrats. So really, right now, if the messaging sticks, it's kind of a losing issue for Republicans. And something else that KFF found in their analysis is that roughly 80% of people who receive these enhanced tax premiums or benefited because of them live in states that President Trump won in the 2024 election. So, this isn't, an easy topic for them, but jumping on kind of the hardline Republicans, one thing that is a sticking point for them, and it's something that Democrats don't really have an answer for yet, is that a CBO estimate places the cost of keeping these premiums, especially if Democrats want to make them permanent, beginning in 2026 through the next 10 years from following that, it would add $350 billion to to the budget. And so it's not this. There are a lot of considerations to put into place on both sides when we're talking about these.
Yeah, and just jumping off that, if past is any history from what I know from covering Republicans, is that any extension, I'm sure that the Freedom Caucus and a whole bunch of other conservatives beyond the Freedom Caucus are going to say, any extension of this has to be met with offsets and spending elsewhere, and finding those is going to probably be difficult.
And Joseph, just to go back to the ACA, also known as Obamacare, and those subsidies, we're seeing a majority of Americans are opposed to those subsidies not being extended. If they're cut, if they're not, how many people would be impacted?
So earlier this year, we saw estimates of 3 million. Now we're seeing estimates around 4 million. So somewhere between 3 and 4 million are estimated. I think one thing to note is that under the prior administration, the Biden administration, we saw 4 record years of record enrollment through the ACA. This year, we had around 24 million people enroll, which is a record. And that's actually more than double what we saw in 2020 when we had around 11 million people enrolled in the ACA. And a lot of that was due to these enhanced tax credits, which were passed in 2021, extended through 2025 through the Inflation Reduction Act. This is very much a legacy of former President Biden. So if we were to lose 3 to 4 million, that would take us somewhere around maybe 2024 numbers. So but again, that's following a record significant growth of enrollment.
Excellent.
Through their funding of the continuing resolution, Democrats are also trying to remedy the Big Better Bill, or the Big Beautiful Bill, the cuts to the Medicaid dollars that hospitals receive from the federal government for emergency care, things like that. Now, when it comes to the percentage of people that are actually getting this is a small percent, but right now it seems that federal workers are the ones paying the price for this argument. And I guess, can you just talk with me about that?
Yeah, it falls down to, rural hospitals are, we knew this coming beforehand that during the debate that rural hospitals will be impacted mostly by, significantly by the Medicaid restrictions, and Republicans were keenly aware of this. They tried to ameliorate that through some other legislative maneuvers. But at the end of the day, federal workers are the ones who have to sit down and, make this happen. We're seeing this with the current shutdown, where some Medicaid services are being delayed, or they're not as salient because of the shutdown. So it just comes down to, it's run, the government is run by people, for better or for worse. And the people are the ones who are getting caught in the crosshairs.
I think that's all the time we have. We have a slate of a ton of great guests to bring up on stage, but thank you so much to Emily, Joseph, and my co-host Bree for this conversation. We're really looking forward to dive more into healthcare. Oh, and I was reading those time cues wrong. The beauty of television, everyone. It's like it's like a game of charades that Julie and I play. Emily, so we're going to keep going.
Great.
Speaking of keeping going, I'm going to ask you a question that's going to probably annoy you. Predictions for government shutdown. How long are we going to do this?
Well, let's see. I think that the fact that there's no formal negotiations happening right now is not a good sign for a government opening soon. Look back to previous shutdowns. The last one, that was 35 days. Really, that was, over border wall funding particularly, and that really only prompted things to open back up after air traffic controllers started calling out sick, flights were being impacted. Really, the American public really started feeling the impacts of that. And I don't think we're seeing a lot of impacts on the public yet. We haven't even reached the first missed paycheck for federal workers yet. But one date that I do have my eye on pretty closely is October 15th, which is the next date for service members to get their paycheck. And in previous shutdowns, service members were not really impacted. Either Congress had passed funding for the military, or they had passed a law to continue paying the troops in the shutdown. But this time, we don't have that yet. So that would be kind of like a political pain point where either I would think maybe Congress passes something before the 15th to try and pay service members, which would be a sign this is going to go a little bit while longer. Mm-hmm. Or if that's missed, that would be pretty unprecedented.
If I could jump on, October 15th is also another pain point because it's also the first day of open enrollment in, is it Idaho? It's one of the, I swear I had this information in my head yesterday, but that is the first, Speaker Mike Johnson says they have an eternity to negotiate this thing. They have 3 months. But really, they have before November 1st, which is when open enrollment starts for the rest of the country, but they have maybe a week before that starts in one state for a lot of other people who are, looking to get on that plan. So, tick, tock.
And we have had like a little bit of indications. There was a comment, I think, Senator Collins yesterday said something. Yeah. She was like circulating a discussion draft of what negotiations could look like, maybe. Huh. So, that's some signs. President Trump yesterday indicated he was open to negotiating on ACA extensions before, saying, but only when the government opens up, kind of keeping with that messaging from Republican leadership. But, right now, it's just warring messaging and press conferences and really Republican senators trying to pick off some more more moderate Republican senators who voted to keep the government open back in March, hoping they change their minds. We haven't seen that shift yet.
Well, and since we're playing the guessing game, I hate to put you guys on the spot, but who are you keeping your eye on? Because someone's going to have to budge. If you had to point to a lawmaker that you'd keep a close eye on, who would you guys keep a close eye on and see that maybe they're going to come over to the other side?
Well, I don't cover the Senate as closely, but I think that the two senators from New Hampshire, Jeanine Shaheen and Maggie Hassan, are both Democratic senators that Republicans are looking at. Senator Brian Schatz from Hawaii is also someone that people are looking at because he voted to reopen the government. Really, Gary Peters in Michigan is another one that people are looking at. So they're not having any, not moving quite yet, but those our colleagues have reported are senators that our Republicans are looking at to try and sway them.
I'll throw this to both of you. One lawmaker that I'm interested in is Senator Mike Rounds. He's a Republican, but he has expressed some willingness, openness to extend those Obamacare subsidies. Could he be a major player or major someone who could shake things up here?
I'm going to be honest, if Emily doesn't cover the Senate as closely, I even less so. I'm stuck in policy world a lot. I can't say I'm familiar with Senator Mike Rounds, and how he falls into the plate significantly.
Yeah, I think that's going to be whoever is negotiating what ultimately will happen. It will be very, very close, I think, to Republican leadership because they are going to have to get the support from their conferences in order to extend this. I mean, like I've had, Republican leadership sources talk to me and say, I think people are underestimating how resistant some of the members of the House Republican Conference are to extending these tax credits, and it's going to be like a pretty, big lift for them. It's not impossible. We've heard, some willingness even from, I think, more conservative members to maybe extend this. I think, I'm sure everybody in this room has seen Marjorie Taylor Greene go on X last night and say she was open to extending those, which is pretty shocking. She's a little bit on an island by herself, but that shows that it's not completely out of the question.
Well, I just got the wrap it up signal from my producer, Julie, and I'm not kidding this time, I'm serious. So thank you all for joining me on stage today and joining Bree. This is a great conversation and good luck in reporting, covering a shutdown. Interesting days in Washington.
Thank you.
Thank you.
Now joining Julia on stage, please welcome Senator Roger Marshall, a physician and advocate for the Make America Healthy Again movement.
Julia, good to see you.
Thank you so much for joining
Good morning.
me.
Good
Yes,
morning.
I'll let you go.
We're going to share a couch?
This is perfect. We'll share a couch. It's a fireside conversation.
There we go. I feel like I'm in therapy already.
There we go. There we go. Well, we're talking about healthcare. So.
Julie, who's in the audience today? Help me out. Who am I talking to? Are these healthcare professionals or?
I think we have a mixture of healthcare professionals, advocates, people in this policy space.
Okay.
Folks who are looking to, I guess, get more into the conversation on, healthcare in Washington and how it's impacting their own industries. Senator, I don't know whether to call you Senator or Dr. Marshall right now. So just to start off, so we can the audience can get to know you, what's it like being a lawmaker, but also having a background in medicine? I mean, they go hand in hand, but they're very different.
Yeah, so I practiced in rural America, delivered a baby every day for 25 years. I'm an OBGYN. I think what makes me unique up here, though, is I'm the only member of Congress that's ran a hospital as well. That a group of doctors and myself went together, formed our own rural hospital, had some success, and I also oversaw 3 county health departments. So I think I've seen this from all sides. Of course, we all train in a big med center, and we went to a big residency program. But I think it's having the practical experience. So the ACA is something that I had to implement when I was running the hospital as well as medical practices. The worst nightmare of my life, trying just to organize and taking nurses off the floor and turning them into data entry people, and seeing doctors having to spend more and more time as data entry. So I think it gives me a real perspective of what's really driving the cost of healthcare up.
Right, and speaking of ACA, obviously the conversation surrounding those subsidies and the conversation surrounding healthcare is such a central part of this shutdown right now. I know the Senate is voting later today on another stopgap, I believe, but where are we right now? I mean, I hate to ask you to play crystal ball, but how long is this going to last?
Yeah, I don't think anybody knows that. And, if I don't really believe that the ACA is the real issue. I think it's really a political issue. And that Chuck Schumer got in such trouble with his base, and I don't know if it's his base or AOC's base, for not shutting the government down. They want to do something to respond to President Trump. I mean, he's had some incredible successes. The One Big Beautiful Bill, the most consequential legislation of our lifetime, perhaps as well. So he had to do something. And then they've taken this hostage, which is the COVID subsidies. And I think that's a big misconception. I know people, not many members of Congress understand the difference between the original subsidies versus these additional COVID subsidies, where we went from spend for the government paying 80 to 90%. The problem with the Affordable Care Act is it isn't affordable. That's the real problem here. The real problem is the cost of health care. And the friends across the aisle think they can just keep throwing money at it. If we just keep throwing money at it, regardless of what we're doing, premiums are going to go up 20%, right? Regardless of what we do, premiums are going to go up 20%. And then there's so much fraud being involved with these COVID subsidies. When we started having people with zero pay as having their insurance, we saw fraud go way up. So there's people out there that are making a living. All they need is a person's name and their birth date, and then they're selling them this insurance product, but the person doesn't even know it. I think like 30-some% of people on these COVID subsidies don't even use their insurance, which means they don't even know they're on it, as opposed to having to make a monthly payment. Then they would say, wait a second, where's this payment going? So we have to address the fraud, and we have to address the true problem is that the Affordable Care Act is not affordable.
So I guess how do you communicate that to Americans? Because some of the polling we've seen shows that Americans are concerned about these subsidies not being extended. They seem to maybe be siding with Democrats. How can Republicans better message what you just said?
Yeah, and I think it is very challenging because it's a very deep issue. And look, I want everybody to have health care. It's part of my MAHA, pillars is everyone have access, meaningful access to affordable health care as well. I think that they're asking the wrong polling questions. I think if you ask polling questions like, if you knew that these COVID subsidies, that there was $25 to $50 billion of waste, fraud, and abuse, would you suggest that we fix it? Or just keep going on as is? So I think we're asking the wrong polling questions, but it's very hard to message because it's a complex topic.
I want to switch gears and talk about Make America Healthy Again, that initiative. I know you penned an op-ed in The Hill earlier this year leading up to Kennedy's confirmation in the Senate. Talk about how, the progress MAHA has made, 8 months in.
Yeah. Well, it's we're on Trump time now, so it's not fast enough. It's very hard to move this needle around. You think about America. You want me to drive down the cost of health care, we have to address America's health. 70% of Americans have a chronic disease right now. 20% of our children are on a prescription drug. 30% of our children are obese. 40% of our children have a chronic medical problem. So it's very, very hard to turn around the health of America. So what I've tried to focus on is 4 pillars. Secretary Kennedy is doing what he can through executive order, and then I'm working on a legislative package to address these pillars. So my 4 pillars are number 1 is precision agriculture and healthy soil. And then number 2 would be food as medicine. Number 3 is meaningful access to affordable primary care. And then number 4, address the mental illness and the neurodegenerative disease of our children as well. So we have packages of legislation. It won't be simple to get those through. So it's not going quick enough. I think that the first MAHA report maybe missed the mark a little bit. Okay. I think the second report was a little bit better. And I think most importantly is Secretary Kennedy and the MAHA group and agriculture now on the same page, okay? And what I think is healthy soils where agriculture meets MAHA. So rather than telling our farmers what we can't do, tell them this is our goal. Our goal is healthy soil, and with proper precision agriculture, we can use 50% less fertilizers and chemicals, and we can decrease the drift of those chemicals from the field by 90%.
Right.
And therefore less toxins in the water. So we're getting there. We're getting there. We got a long ways to go.
Yeah, and think there's a fair number of voters, I've talked to them, who think all of those initiatives are great. They like the removal of artificial food dyes, for example, from food, all of that. But when they look at MAHA, I think a central theme they see, or something that sticks out, is Secretary Kennedy's past remarks on vaccines and questions about vaccines going forward. You know, what would you say to those Americans who are maybe, they like some things about MAHA, but vaccine skepticism, that just sticks out to them?
Yeah, you know, it's a tough one. And, you know, the sad thing is Congress has spent 95% of our time this quarter, I've got like a quarter of school, working on vaccines. Look, vaccines are 1/10 of 1/100% of what we should be working on from a MAHA concept. So it's too bad that we've let that sideline us. I'm very much of the opinion of in valuing the patient-physician relationship and informing patients, you know, the pros and cons. And we don't need to dive down there. But this vaccine skepticism was actually created by Dr. Fauci when he lied to America about the mRNA vaccines and what it would and wouldn't do as well. So I think we're still, and they lied about the origin of the virus, all these types of things. So we're inheriting that. We're inheriting this vaccine skepticism. And this is, it's just, I don't know why, but people are just obsessed with it. But I'm so ready to move on and let parents decide with their doctors what's best for their children.
And I think just, you know, there's a lot of confusion among Americans right now because there is information overload, whether it is from the government, from lawmakers, from social media, from, you know, the news media. I mean, a few weeks ago, we had this nationwide conversation about pregnant women taking Tylenol. We talk about vaccines, et cetera. What's your advice to Americans who don't know where to get healthcare information? They don't necessarily know who to trust because there's a lot of conflicting opinions.
Yeah, how about your doctor? I don't understand what the confusion is. I know your history. I know what you're high risk for, what you're doing, your social history as well. And let's make a decision together on this hepatitis vaccine for your child as well. So I think your doctor, you know, the nurses typically do a really good job as well. And you're right, there's just too much information out there, and everybody overreacts to one study. If I overreacted to every study I saw that something, coffee causes cancer, wine causes cancer, no, wine's good for you, no, wine's bad for you. So, you know, just quit, you quit it. Take it all with a grain of salt and ask your doctor.
That's so interesting because someone told me that Sauvignon Blanc has less sugar than red wine, and I thought red wine was the healthier one. Well, I digress. Vice President Vance echoed that point. He said, talk to your doctor. Do you sometimes wish that President Trump and Secretary Kennedy would say, talk to your doctor, prioritize that?
Gosh, it's hard to decipher everything they've said or not said. I assume they've said that before, but I don't remember.
I see. You know, let's dive into women's health here and, you know, maybe how MAHA could impact women's health. What are some of the initiatives on that front? I know you're an OBGYN, so just wanted to get your perspective there.
Well, you know, as we see what's driving maternal mortality, let's start there. When I was in med school and residency, the drivers of maternal mortality were strokes and infection, hemorrhaging, complications from anesthesia. So when I came to Congress, oh my gosh, Bernie Sanders says, how come maternal mortality is going up? And I cited the things I just cited. But I said, you know, I haven't seen a really good study in a long time to really figure out why we're having this spike. So we passed legislation to fund a study. And guess what it showed? And we had experts in front of HELP, and I'm asking them the same question. What's the number one cause of maternal mortality? When you measure maternal mortality, you go for the year after having the baby. Guess what the number one cause of maternal mortality is now? So it's suicide and fentanyl overdose. So what that means to me is after this patient's delivered, you know, the delivery's not over with. I mean, we have to hang on to that patient and figure out what's going on in their personal life as well. And certainly there's risk factors, and I don't want me to get too quirky on here and go too deep, but I think that would be one thing. The other thing that's exploded, of course, is diabetes of pregnancy. You want to know why our C-section rate is going up. In addition to malpractice issues, it's obesity. I just dedicate one day a week to doing nothing but taking care of having a diabetic clinic I would typically see 40 to 60 patients every day, but one of those days was just for my diabetics.
Wow.
And of course, those turn into type 2 diabetics later, et cetera. So I think, the MAHA thing, there's nothing magical. We need to execute a simple plan well. So it goes back to nutrition. Give me a healthy mom with good nutrition before she gets pregnant, and I'm going to celebrate. I mean, that's all I ask for is a healthy mom. But when they come in with type 2 diabetes, all your risk of complications double and triple. So I think it's simple things like that. I would start there.
Right, and forgive me, I'm not a doctor, so when you talk about diabetes and link it to MAHA, you're talking about maybe the processed sugars, the added sugars into food. That could be a contributing factor there.
Yeah, all the above. Certainly 70% of America's calories are ultra-processed food. I challenge everybody to spend a week and don't open a sack or a box. Okay, just try it. And so 70% of our calories are ultra-processed. It's the sugar and the salt as well. But it's all linked to the type 2. The diabetes of pregnancy is certainly linked to obesity. But then for some women, they have a genetic predisposition to it as well. And I won't bore you on the insulin receptor business here. But so you throw in a pregnancy and hormones, and they start off overweight. They're just walking into to diabetes of pregnancy. It's called A2 diabetic.
I feel like recently when talking about healthcare, and we only have a few minutes left, one topic of conversation that comes up, I think nationally, and especially among women, it seems, is patient advocacy. I hear this message, advocate for yourself with your doctor. Talk about that. It seems that it kind of ties into this theme of having a trusting relationship with your doctor. Wanted to get your thoughts on that.
Well, that's a tough one. I don't understand it. I mean, that's why I wanted to be a doctor, is to have a relationship with you. And now people want drive-through medicine, just like they have drive-through fast food, and it doesn't work. My wife has an asthma problem. I'm a senator. It took me 6 weeks for her to get into a doctor up here. And she ends up seeing a PA. I mean, with all due respect, the reason we chose a pulmonologist and not a primary care doctor is because she has a very significant asthma problem. I want a doctor that's went to 4 years of medical school, did 4 years of residency, has seen 100 asthma patients this week, not a PA. So we went through this drive-through medicine, urgent cares and ER visits, and frankly, I don't understand today's medical students and new residents why. I mean, they want to work 30 hours a week. Like, come on. That's not why we signed up for this. I worked 100 hours a week my whole life. That's just who I am. So I'm baffled by that as well. But I think you're onto something, that it is the relationship part of this. But by the way, I could link this back to the only people whose healthcare costs aren't going up are people employed that are self-payment model, self-insured, and direct primary care, where this one doctor and his team of PAs and nurse practitioners are managing these 200 patients that are employed here, or 2,000, whatever it is. And the secret there, though, is that relationship, so that when someone calls me up and says, this is what's going on, I know you. Like, okay, you're having chest pain, you're a farmer, and you don't want to get off the tractor. My gosh, you're having a heart attack. Get your butt in here. So you have to know the patient, like who you need to coach up. Yeah, anyway.
Senator Marshall, I could talk politics and medicine with you all day. Unfortunately, our time is up, but thank you so much for taking the time to sit down with us.
Everybody. Thank you.
Please welcome Bree Jackson back to the stage, joined in conversation by Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation.
Dr. Besser, thank you for being here. It's a pleasure to see you in person. I've seen you on TV quite often, so thank you for being here.
Well, thanks for having me. I'm looking forward to the conversation.
Well, so the government is shut down in large part because of this issue of health care. And as a doctor, and someone that oversees the largest private foundation that's devoted solely to improving the nation's health, I know there may be a lot of them right now, but what are your biggest concerns?
Wow. That is a tough question. Since day one of the administration, we have seen an all-out assault on people's ability to lead their healthiest life. So this latest chapter with the shutdown and discussions around subsidies for the Affordable Care Act is a very small part of what's taking place. If you look at the actions of the administration, firing of thousands of health workers, the reconciliation bill, which has led or will be leading to millions of people losing health insurance, millions of people losing food supports. These are critical factors for people and their ability to lead their healthiest life. Listening to the senator, people want to have a relationship with a doctor. We are moving towards a situation where tens of millions of people won't have that opportunity. And what that does is it shifts the cost of care to medical institutions that may not be able to support that. One of the big concerns about the reconciliation bill and the big cuts to Medicaid is the strain that's going to put on rural healthcare in particular. Rural hospitals depend for a large part on Medicaid dollars to stay open. And it is a challenging situation. And so any cut to Medicaid will put a strain on those hospitals. And I'm part of the Aspen Health Strategy Group. It's a bipartisan group, and we focused on rural healthcare this year. And one of the things that was really stressed is that when a rural community loses its hospital or its clinic, you don't only lose the opportunity to have healthcare nearby, you no longer are attractive for business to come in. No business wants to move into a rural community if there's not healthcare available. So it is a really complicated issue, but it's a big issue in terms of economic development. And if you look at the biggest drivers of health for people, it's income. So if you're losing jobs or you're losing your healthcare, you are creating a situation where health, just the aspect of leading a healthy life, becomes out of reach for millions and millions of people.
And you touched on this, but you mentioned the firing of health workers. We've also known that some health departments have been cut. And I guess in all of this that's happening, which communities do you feel may be suffering the most from all of these cuts?
Yeah, I worked at the CDC for 13 years. And I also worked in federally qualified health centers as a general pediatrician for more than 30 years. And so the game of who's going to be hurt the most strikes me as the wrong game to be playing. Public health is practically invisible when it's working. But when it's not working, and the system is stressed with a new outbreak, with a water system that is making people sick, it becomes very, very visible. And public health is one of the great levelers in our society. It's one of those things that helps ensure that everyone has the opportunity to lead a healthy life. So whether you're talking about vaccinations and making them available for free to all children in America, or you're talking about having a public health system that makes sure the food you eat is safe, the water you drink is safe. Public health is that equalizer. And the CDC, the vast majority of the budget that comes to the CDC is passed through to state, local, tribal, territorial health departments. So these billions of dollars that were pulled back are going to affect health in all communities, and you're going to see that. You saw it very early. Milwaukee was dealing with a problem with lead poisoning in the water, and they called CDC to get support, and the department that focused on lead poisoning was gone. It was one of those departments that was cut early on by Secretary Kennedy. Those things, you only see it when they're stressed, but if you're in a community and you can't drink the water, you feel it.
And speaking of Secretary Kennedy, you've been a vocal critic of Secretary Kennedy, and in a letter with 8 other former CDC directors, I'm going to use your words in this letter, that you accused Secretary RFK Jr. of endangering every American's health by dismantling established scientific norms. in your view, what are the most immediate risks posed by these leadership changes?
Yeah, the idea that we have as a Secretary of Health, one of the nation's leading anti-vaccine advocates, is absolutely frightening. As a general pediatrician, I spent a lot of time talking to parents about vaccinations and answering questions, the pros, the cons, those issues. But when you have a Secretary of Health who is so anti-vaccine, who clearly has come in with a very strong agenda to make it harder and harder for parents to do the right thing for their children, to do what they want, and that's protect their children from preventable diseases. It's absolutely frightening. I mean, it's hard to pick one action that he's taken. The firing of the advisory committee to the CDC that makes recommendations around vaccination. You know, this was a committee of experts that included the various medical societies that take care of patients around the country, experts in infectious diseases, experts in epidemiology and vaccine science, fired them and replaced the committee with largely anti-vaccine advocates. And so to watch the committee hearings and see them try and come up with recommendations, it was really disturbing. And so, you know, as a pediatrician, I'm not practicing now, but if I were, I would not look to the CDC anymore. And the CDC was really the world's crown jewel when it came to a public health agency. And unfortunately, that's not the case anymore. There's terrific people still working at the CDC, but its ability to do its job has been severely compromised.
And you touched on this a little bit, but we know there's a lot of medical disinformation swirling around out there, in particular around vaccines. And why is this, this misinformation around vaccines so crucial, so hurtful?
It's hurtful because parents want to do the right thing. And anything that the government does that undermines trust in vaccination will lead some parents who want to do the right thing by their children to, I think, make the wrong decision. The CDC doesn't mandate the vaccination of children. It makes recommendations. Those recommendations are then taken by states, and it's states, and in some places it's cities and local public health departments that set the requirements for school entry. But following the Secretary's committee hearings, you saw Florida, the Surgeon General in Florida basically say that vaccination for children going to school should be voluntary. That is a frightening thing. You know, I've done a lot of global health work, and I've seen wards of people with polio. That's not something we want to see again in this country. And it's not fear-mongering. These diseases are under control because we vaccinate. And we vaccinate because the diseases that could come back with a fury can be devastating. And so it sows confusion for parents when you have a secretary who is spreading so much misinformation about vaccination.
Now, shifting gears a little bit, you said that you want that the Robert Wood Johnson Foundation's vision is to make health a right, not a privilege. What does that look like in practice in the context of current policy proposals around Medicare, Medicaid, mental health, and women's health?
So philanthropy is in a very privileged position. We can take a long view. And so, you know, we are seeing policy after policy that is taking us in the wrong direction when it comes to health. It is creating more and more barriers to health. When you see the administration come in and slash the budget for the National Institutes of Health, cancel any grant that has the words diversity, equity, and inclusion in it, research to try and understand issues of maternal mortality. We were hearing a conversation around that. You know, why in America are black women twice as more likely to lose a baby or to die during pregnancy? I mean, that shouldn't be. You can get to the answers with research, but if that research isn't allowed, it moves us in the wrong direction. I lost the thread.
It's a complex issue.
Yeah. So you know, we have an administration that has a fundamentally different view on its role and the role of government in terms of people's lives and health. And when you look at philanthropy's role in this, that's where we were, philanthropy. We can stick with this for longer. And one of the things that gives me hope is that the systems that we see, a healthcare system that does not work for everybody, it's not about getting back to that. It's about creating a vision for what could be. We're the only wealthy nation in which the entire population doesn't have access to healthcare. Well, that doesn't have to be. We can create a way of getting there that is much less costly than the system that we have. We had a public health system that did not work for everybody. Well, what could it look like to have a public health system that did? And so philanthropy can work with others to create a vision that is inspiring, that motivates people to say, no, this isn't it, but here's what could be. And that's what we want to see.
What role does the private sector play in developing this equitable system?
Well, you were saying that I've been a loud voice speaking out. I've heard silence from the private sector. And I think, until we see the private sector speaking out, it's going to be very hard to move the needle. But the private sector, when you see millions of people losing their affordable care subsidies, this is going to add to the cost that the private sector bears. We're the only nation where so much of healthcare is provided through insurance that you get from your employer. Well, let's work for a system where that isn't the case. If you look at the advances in medicine and biomedical science, so much has come from the NIH, and then the private sector has moved forward with commercialization. Well, if the NIH isn't doing that, well, it's going to have to come to the private sector to build the research capacity that we've seen here in our universities and in the NIH. So I want to see private sector leaders standing up and saying, no, this isn't right. This isn't, the US should not give up its role as the leader in biomedical science. There's a lot that the private sector could be doing that it's not. And I think part of it is that each sector, one by one, has been frightened into silence. And that has got to change.
In AI, this is something that's become a part of our everyday lives. What role do you see AI playing in improving health systems?
Yeah, artificial intelligence has incredible potential for good, but it also has potential for harm. And one of the areas that we have concerns about is if you look at AI that's used for medical decision making, it's based on existing data. And if existing data has built into it bias by race, by gender, by sexual orientation, then the AI itself is going to generate biased outcomes. And that's something that we have funding that's working to address that. But you need to see the sector really embracing that in a big way. If the reason for different outcomes by race or by gender has to do with barriers to health, barriers to access to health, barriers to compliance, barriers to making it harder to come for follow-up, you may see in those data systems that the outcome by race and gender are different. But if you can address the underlying cause, differences in income, differences in outcome, you'll see those go away. And so it's very important that we don't build AI systems that entrench and solidify the structural racism and sexism that's in our healthcare system.
And we've talked about some barriers here, we've talked about challenges here, and even in talking about these tough issues, you seem to take on an optimistic tone about achieving health equity. And just where do you see the momentum in achieving that and moving forward with health equity?
Pediatricians by nature are optimists. And so, I come at the world from that perspective. When you see a child, or you bring a child into this world, that in and of itself is an optimistic perspective. When I see young people standing up and saying, no, there's a better way, that gives me optimism. When I hear people speaking out and saying, not only is diversity, equity, and inclusion not illegal, these are fundamentally American values. We have a nation where everyone should have the opportunity to dream and see those dreams come true. And if we can provide a vision for that, it's going to rally people, and we're going to get there. So I do see this moment as one where we need to not say, let's go back to what was, because that wasn't working for so many people in our country. We can provide a vision for something better.
And we've touched on a lot of different topics today, so thank you for going through all these topics. But for you, what's the most important message that you want to send to this room when they're walking out, when they leave today? What do you want them to remember about this conversation?
What we are seeing is a wholesale destruction of our public health system, and we cannot allow that to take place. We need our elected officials to do their job and to say this is going to harm the people who brought us into office, and we can't accept this as the new normal.
What's the call to action?
Stay informed. If you're a parent, talk to your doctor about vaccines, because we're entering the winter season, and that is a time when there's a lot of respiratory viruses going around. But find out the pros and cons and make the right decision. But if I were a parent and I were sending my kids to school, I'd want to know what the vaccine coverage rate was in my kids' classroom.
Dr. Besser, thank you for your time today.
Thank you.
Please welcome Dr. Lauren Chung, Head of Health Products at Apple, in conversation with Julia Manchester.
Dr. Chung, it's great to be here, and thank you so much for joining us. I appreciate it.
Thank you so much for having me. It's really fun to be here.
I'm really excited for this conversation because I think oftentimes when I talk about wearable health with friends and family, the question I have is, how does it know if it's on your hand or your wrist, what have you? Obviously, the Apple Watch goes on your wrist and it's connected to your pulse, all of that. I won't get too in the weeds there, but I wanted to get your take on how is wearable health changing. I know that Apple has really dived into the hypertension space, for example, which is fascinating to me.
Yeah, there is so much going on in this space right now, and so it's a really exciting time to be here. When it comes to wearable health, I'll talk a little bit perhaps first about how we think about our mission in health. And what we're really here to do is to empower our users to live a better and a healthier day. And we do that by really making sure that we're democratizing access to important health insights. Ones that maybe you would traditionally only get in a clinical setting, but we're taking those clinically validated tests and bringing them to life in really fun, enjoyable ways where you can use them to really take care of your own health in a proactive and preventive way.
I understand that Apple talks about 3 principles that are crucial to Apple Health. I was wondering if you could go over those with us.
Yeah, so we like to say that there are 3 principles that are core to everything that we build in health. The first is that all of the data that we show to a user is actionable. So we spend a lot of time and energy really making sure that everything that we show a user is really grounded in something that they can take action on, whether it's an irregular rhythm notification that is allowing them to understand that they might actually have signs of atrial fibrillation, which can be which is an irregular rhythm that can actually lead to stroke, or whether it's an abnormal cycle pattern. And so they need to go and talk to a doctor maybe about that issue. And so we are really there to make sure that the information that we provide someone is actionable and, again, presented in delightful ways. The second core principle that we find truly important to everything that we build is that all of our features are grounded in science. That's why there's clinicians like myself that are really embedded within the design and engineering teams. We're there to not just make sure that we're grounded in science, but to really make sure that we're bringing in the best practices from medicine. So that means also bringing in a human touch to the way that we build our features so that we have that bedside manner that we're using that can make it feel a little bit less scary if you're getting a notification. And then the third principle that we build on is that everything that we do is grounded in privacy. So we start with privacy from the beginning that we build features. It is built into the core of everything that we do. So if you have your default settings enabled, all of your information is encrypted on device and also when it's backed up to the cloud. And so we can't access that information. We don't provide that information to anyone else. It's really your data, and it's your choice to do exactly what you want with your data.
On that issue of privacy, what are maybe some other ways that Apple, through wearable or in wearable health, is protecting privacy? Obviously, you talked about how users choose how to handle that data, but how is the company protecting that privacy?
Yeah, so we truly do believe that privacy is a fundamental human right. And in order to protect that, if you have your default, if your device is locked with passcode, Touch ID, or Face ID, all of the information on device is encrypted while there. And if you are backing up to the cloud and using your default two-factor authentication, then it is encrypted while in transit to and while stored on our server. So again, we can't access that information. But what is really important is that because we're building it in right from the beginning, it actually means that we run our studies differently, and actually that we have to do many more studies than most people would, because we actually have to go out and collect consent to actually get your health information to be used for product development. And because of that, we're conducting research in novel ways. So in our research app, we actually allow people to choose exactly which data they want to share with researchers, which is something that's very unique to our study. And sometimes that means that we actually release some of our features a little bit slower than others might, because we are really dedicated to ensuring that privacy is built in right from the get-go.
I want to turn to women's health. Obviously, in conversations about wearable health, I understand that Apple, other tech companies are really zeroing in on this space. How is Apple looking to hone in on women's health?
Yeah, it's been a large passion area of ours for quite some time. I think one of the things that makes what we do so impactful to those around us is that we're not afraid of the hard or even sometimes uncomfortable topics that are meaningful to health. And that's menstrual cycles as well as mental health. And so we were probably the first big tech company out there to actually, in a keynote, get out and describe and really kind of evangelize our menstrual cycle tracking features. And those menstrual cycle tracking features are there because the menstrual cycle is absolutely critical to a user's understanding of their health. And so we want them to be able to track that aspect of their health, and also to get notifications when we notice an abnormal pattern arising in their cycle. And so we've spent a lot of time and effort to not just build features that can help users understand what is normal in their menstrual cycle, but also to advance the science. And that's where we, at the same time that we announced our cycle tracking features, announced a groundbreaking, large, longitudinal digital women's health study, which was one of the first of its kind. And that study is continuing to run. And we had numerous publications in partnership with the Harvard T.H. Chan School of Public Health to really advance the science of women's health.
I understand there's a lot of new health metrics that Apple now tracks. Which ones should a new user focus on as they're starting their wearable health journey?
Yeah. So there are so many to choose from, I'll say. Now, we have features in 18 different areas of health and wellness. But what makes health so difficult to so many people is that health is largely invisible, right? So many people don't actually know if there's something abnormal going on or if they need to seek attention. In fact, we know that 60% of American adults actually only seek medical care when they are feeling ill. And so we've actually been building features for a long time to really change the way that our users interact with health, to make sure that they're getting the meaningful information they need so that they can take action in the moment. And we've been doing that, again, as mentioned, for years. But I want to highlight kind of two of our newest features that we're really excited about. So last year, we introduced end-to-end hearing health features that include an over-the-counter, medically regulated hearing aid as well as hearing test for the billion people out in the world that are actually suffering from hearing loss. And then this year, we've been really, really excited to announce our hypertension notifications. And if that's something that you don't have turned on, we absolutely recommend that you turn that on. So hypertension or high blood pressure is a disease that affects over 1 billion people in the world, and it is estimated that about half of those people don't even know that they have it. And that's important because hypertension is often called in the medical realm the silent killer. It's something that is completely asymptomatic, and so people don't know that they have it. But if it's left untreated, it often leads to stroke, to heart attacks, or even heart failure. And so now with hypertension notifications, you can wear your watch and get notified if you have signs of what we call stage 1 or stage 2 hypertension, so that you can then go have an informed conversation with your doctor on what the next steps are that you need to take.
How, with something like hypertension, which is so under the radar, forgive me for sounding naive, but how can it tell? I mean, what are the metrics that it's using?
Yeah, so the hypertension feature is built off of a variety of different sensors on the watch, but ultimately takes a look at the blood vessels and understands through the patterns that we are detecting and using AI. It tracks over the course of a month whether or not there are patterns that are similar to those of someone who might have hypertension.
Gotcha. We're sitting here in Washington, a lot of healthcare advocates or people who work in the healthcare space in this room right now. What actions are you most interested in seeing from Washington, from the Beltway, when it comes to digital health?
So digital health has just a tremendous ability to impact health broadly, not just healthcare, right? So when we think about healthcare, we often think about the direct interaction that you might be having with a doctor or the direct care that you're receiving from a doctor. But what we're building is actually building health. And so we're expanding someone's ability to take care of themselves. It's not just about when you're feeling ill, but really about trying to get ahead of it. And that's what we're doing with our everyday features, is really helping users understand what might be going on so they can have that informed conversation with a physician earlier, before they end up with a bad outcome. And so when it comes to what folks on the Hill can do, for us, it's really been about increasing access to these devices. We know that there's acts like the Wear It Act that have been proposed that allow users to actually use their HSA and FSA funds to purchase these types of devices so that they can actually use kind of the everyday features, but also really use all of the health features that are available on them as well.
What has the feedback been to a number of these health features? I mean, I know the majority of people I know have an Apple Watch or use Apple Health in some way, but what are some of the more popular, programs or metrics that users use, and what do you foresee becoming more popular?
That is such a hard question to answer. It has actually been a really fun journey for us. We have gotten what we call Dear Tim letters, where our users are writing into Tim, kind of telling us about all of the things that they have found by using our features, and they've been really, truly inspiring. And so we've seen folks bring in abnormal heart rate trends to their physicians. We've seen folks bring in notifications from their regular rhythm notification to their physicians and getting diagnosed with that. I mean, every single feature that we've built, we've actually had some sort of notification or some sort of letter that's been sent to Tim, really kind of saying how much it's changed their life. But I'll point out one that has really been near and dear to my heart around mental health. And so a couple of years ago, we released one of our newest mental health features, which we call State of Mind. And we did that because mental health is as important to someone's health as physical health, but it's often underappreciated. It's something that is, unfortunately, rates of depression, anxiety are on the rise worldwide. And so we wanted to help users better understand their mental health. And so State of Mind allows people to log their moods and emotions, which by the science we know can actually improve emotional regulation, and through that can actually decrease symptoms of depression and anxiety. Alongside that, you can figure out and see what might be contributing to your mental health. And then lastly, it has a set of mental health assessments or questionnaires. These are the ones that you traditionally get in a doctor's office to evaluate for symptoms of depression or anxiety. Well, now they're available on your phone, and you can do them anytime, anywhere that you want. And so we actually had a user write in and say, right when we released this, that he went in took the assessments and found out they had a severe risk for anxiety and depression. And that prompted him to go to the doctor and have a conversation. He said, this is the best I've ever felt in 10 years. I knew that I had some anxiety, but I never knew how severe it was. And by being able to take that questionnaire on your device, I was actually able to get the help that I needed.
We only have a few minutes left, but what's one area where maybe of healthcare where Apple hasn't explored, where you hope to get involved in? Is there a particular part of healthcare that you could see Apple maybe making more of a bigger presence in?
I think that right now we're at this incredible inflection point in health and a super exciting one. And I won't say that we haven't explored it. I think we're really in the early innings of what we're doing in health, and that there is so many more opportunities to do even bigger and better things. And I'll leave it at that, because I do really think that there's just so many places that we can take it. And it's not just about what we're doing with our own health features. We've really been excited about how we're enabling third parties to actually use these health features as well, and that includes health systems. So we're seeing really delightful ways that health systems are integrating our features into the way that they care for patients.
Dr. Lauren Chung, thank you so much for joining me here today. I appreciate it.
Please welcome the co-founder and CEO of our proud sponsor, ByHeart, Ron Beldegren.
Good morning. What a pleasure to be here amongst so many leaders in health policy. I'm Ron Beldegren. I'm the CEO and co-founder of ByHeart, next generation infant nutrition company. With our launch, we became the first new infant formula manufacturer in over 15 years, and we're one of 5 companies in the country supporting this critically important first food for babies. In the hallways, many of us are talking about this historical time in food, and this really ongoing food revolution. Consumers don't want to wait to get sick anymore. They are taking proactive control of their health and wellness, and increasingly, that is through food as health. At ByHeart, we believe that conversation needs to start in the first day of life and in the first food that we feed our babies. We started the company nearly a decade ago, inspired by the major advances in breast milk science. The tools were there to do better, but this has been a category that 90% of the shelf has been dominated by 3 companies for nearly 100 years, and so the science was moving faster than the industry was. We spent about 7 years bringing the world's experts together in breast milk science to bring forth the first patented new innovation infant formula. We ran the largest clinical trial in over 25 years to clinically prove benefits to babies, and built and established 3 domestic manufacturing facilities here in the United States. It's a pivotal time in our industry. With HHS's announced Operation Stork Speed, it's shined really a light on this critically important first food. And this is really a moment that we can kind of drive this industry forward. We're delighted to provide kind of our lens to help play a small part in ensuring that the goals are met to drive a more innovative and more resilient infant formula supply chain. Because the 2022 infant formula shortage really was a wake-up call. I think it exposed the biggest food security risk in this country that not enough people were talking about. When one plant temporarily went down and half the nation's parents couldn't find sole source nutrition for their babies. That shouldn't be anything that any of us ever experience. But unfortunately, that was sort of the tip of the iceberg, because the role of this industry should not just be that when a parent needs infant formula, they can find it on a shelf. It should be that when a parent needs infant formula, they can find the highest quality infant formula on the shelf. Breast milk science has evolved tremendously, and it is our role to really further, the new kind of nutrition science in this role, in this category. And so, what is there to be done? To the kind of policy makers and leaders and regulators in this room, we're focused on kind of 3 things for consideration. The first is as FDA embarks on the first kind of nutritional review of infant formula standards in nearly 30 years, the conversation cannot only be about subtraction or what we take out of our infant formulas to make it cleaner. It must also be about purposeful addition. What are those bioactive components of breast milk that we are adding to drive its health outcomes? That is a critical focus. Subtraction is very important. You know, as the first company to use organic grass-fed whole milk, we could rely on the natural fat in milk and reduce the need for oils and remove palm oil and soy, and of course we remove corn syrup. But if the goal is to really address the root cause of health, the future cannot just be a cleaner version of a 15-year-old recipe. It needs to be clean and highly functional, like breast milk. Breast milk science has evolved a lot, and we have demonstrated at By Heart that it's possible to bring some of those really important components to formula. For example, we brought the two most abundant proteins in breast milk to formula for the first time, proteins that in their time as humans has evolved to be the first sip a baby takes to build their immune system, to build their gut microbiome, high quality protein to drive metabolic health, proteins that were largely missing from formula until now. So it's time for the regulations to modernize and really look at latest breast milk benchmarking to ensure we're referencing the latest nutrition science. So number one, not just subtraction, but purposeful addition to close the outcomes gap. Number two, we need to raise the bar on claims and marketing in this space to really require rigorous clinical trials to support a claim. No clinical trial, no claim. In this category at a shelf, a parent does not need a laundry list of marketing claims. They need evidence to support this most important decision we make, what to feed our babies. And number three, we should incent innovation, not just shortcuts. We should reward the companies that are investing in original research and in building domestic manufacturing for this critically important product. In conclusion, you know, the MAHA report that came out earlier this year alluded to, you know, families looking to Europe for cleaner infant formulas. We have seen through our journey firsthand the leadership in this country in pediatric nutrition and breast milk science and high quality agriculture. The US should really be the leader in infant nutrition innovation. And I believe that if we focus now in this amazing moment on infant formula, on innovation and quality and supply chain resilience here at home and labeling transparency, we can deliver the infant formulas that today's parents expect and tomorrow's babies deserve. The future of their kind of health depends on it. Thank you very much.
Thanks again to By Heart for their support of today's program. We will now take a short coffee break. For those in the room, stretch your legs, talk to the person next to you, grab a coffee or tea, and enjoy the Truvani bars donated by the Food Babe blogger Vani Hori, who will be speaking later today. After the break, we will also hear from Patrick Quigley, co-founder and CEO of Sidecar Health, as well as former CMS Administrator Chiquita Brooks-LaShore, Nancy Brown of the American Heart Association, and more. Please also check in with us on our social channels. Let us know what you're thinking using the hashtag #TheHillHealth and tagging @TheHillEvents. Welcome back to the Hills Health Next Summit. Please take your seats and turn your attention back towards the stage. Welcome back to the Hills Health Next Summit. October is Breast Cancer Awareness Month. To discuss the importance of screenings and awareness, please welcome Valerie Nelson, Manager of Federal Policy and Advocacy at Susan G. Komen for the Cure, one of our sponsors this morning.
All right, good morning, everybody. I have the pleasure of speaking to you right after coffee, so hopefully you're awake. As you heard, I'm Valerie Nelson. I am Susan G. Komen's Manager of Federal Policy and Advocacy, serving the breast cancer community. Of course, with this being Breast Cancer Awareness Month, breast cancer might be on the mind for a lot of you. This time of year, you see a lot of pink ribbons, a lot of pink things popping up. And while we've made really great strides in the early detection and treatment and care of breast cancer, the fact remains that breast cancer is still a pressing public health challenge, killing more than 110 women in America every single day. That is an unacceptable reality to us, and that is why Susan G. Komen worked to launch the Alliance for Breast Cancer Policy this last spring. So the Alliance is a coalition of 30 leading advocacy organizations bringing together patients, providers, and advocates to drive forward patient-centric, evidence-based federal policy change to improve the lives of those living with breast cancer. This is really important work, and in doing that work, the Alliance is really focused on early detection work. When we can catch cancers earlier, they're easier to treat, there are better outcomes for the patient and better outcomes for our healthcare system as well. And so as I mentioned, in doing that work, the Alliance is really focused on early detection. As you just heard, it's Breast Cancer Awareness Month in October, so this is the time of year that many women are reminded to get their screenings and get their breast cancer screenings. But still, many insurers do not cover the full range of imaging exams needed to get to that diagnosis. We're still at that point, which is why the Alliance is working so hard to drive forward the bicameral, bipartisan Access to Breast Cancer Diagnosis Act. So in this legislation, by requiring that private insurers cover medically necessary diagnostic and supplemental breast imaging without patient cost sharing, we can work towards saving lives and reducing health disparities for especially rural Americans, lower income women, Black and Hispanic women who are less likely to get that necessary follow-up exams if there's cost involved. So I'm really excited, and Komen is really excited, along with the Alliance, to be able to shed some extra light on this issue this month in partnership with the Hill. So we'll be hosting an in-depth conversation on the Access to Breast Cancer Diagnosis Act on October 22nd with the Hill to discuss not only that legislation, but also gaps in access to early detection and what Congress can do to address these pressing financial barriers for women across the country. So I hope you will all be able to join us in that work and in that conversation in a few weeks, but also join the Alliance for Breast Cancer Policy beyond October in honoring breast cancer patients, survivors, and those impacted by this disease across the country, honoring their lives and their work in bringing forward actionable policy change beyond October. So that's it. I hope to see everyone there in a few weeks. I appreciate your time.
Thanks again to Susan G. Komen for The Cure for their support of today's program. For more, please be sure to scan this QR code for the Hill's breast imaging show, Screening Saves Lives, on October 22nd. Now, please welcome Bree Jackson back to the stage, along with Patrick Quigley, co-founder and CEO of Sidecar Health.
How's everyone doing? Great, good. Thank you for answering that. Oh, Patrick, thank you for joining us.
Thanks for having me.
So we want to talk a little bit about Sidecar Health. The mission is to make quality healthcare affordable and accessible to everyone. How are you achieving this?
Well, I think the real thing is, how do you break down barriers to care? And you had kind of mentioned this before we got on stage, if I'd be willing to talk a little bit about my personal journey. And so everyone's healthcare journey is, especially if you're an entrepreneur, entrepreneurship is very personal. So I have 3 kids, very fortunate. My wife and I have 3 kids. And when one of my children was very young, we had a lot of healthcare issues that we had to deal with. And I'm not traditionally a healthcare guy. I'm a mechanical engineer, which would be held against me at every possible moment. So when I needed to access my health plan, I did something crazy. I read my policy. How many of you guys have read your policies? Fantastic. So I read my policy and I realized kind of what my out-of-pocket maximum were, how to kind of get care, because when my son was diagnosed, I was told I needed prior authorization to get access to the care that I needed. And then once I got prior authorization, I was told it was a 6-month waiting list to see the specialist that I needed to do. And I was just approached by my doctor, said, hey, if you can afford to go out of network, you should. And so I read my policy, figured out what my out-of-pocket maximum was, and figured, okay, the $6,000 that I needed to spend, that's worth it, that's what money's for, let's start care. And that's when I started getting bills. And I got $58,000 worth of balance bills in the first year alone. So as I sit back and think about kind of what our mission is and the context of what we're trying to do, it's with that in mind. Like, how do you break down the barriers to care? Because no one should be in my situation. I felt very fortunate that I was able to manage through that, to get my son the care that he needs. And really what we're all about is making sure that no family is in a situation where they can't get their son the care that they need. And for us, it's about how do you go and eliminate those barriers, if that makes sense.
Yeah, absolutely. So talk to me about how does this happen? How do you do this? How are you able to control costs but increase access?
Yeah, so we are a major medical health insurance plan, but what makes us singularly unique is we bend the cost curve while at the same point increasing access to care. And we do this without subsidies, right? So we're not subsidized by the government anyway. The way we do that is very unique in that we leverage the power of consumers, right? So our view of the world is that to fix the US healthcare system, you need to actually go ahead and introduce transparency. Everyone talks a lot about price transparency. That's critically important, but it's more than price transparency. It's also quality transparency. So what we do is we introduce transparency into the decision processes that consumers go through around planned healthcare. And then we introduce incentives for people to be engaged with their doctors about making care decisions. Because one of the common kind of thought processes around health policy is that consumers, it's hard to navigate the US healthcare system, and certainly it's complicated. But consumers are incredibly good, actually, about identifying what they need and actually going and getting it. And so what we do is, again, thinking back to my own personal experiences, is we eliminate the traditional barriers to care. Like, we're the only health insurance plan with no prior authorization. We don't have preferred networks. We don't have contracted networks. We don't have any of that. We don't have step therapy. We don't have formularies. We think that care should be determined by doctors, and our job is to figure out how do we go ahead and pay for it. Right, so hopefully that sounds good to everybody, right? Who doesn't want a plan with no prior authorization and no restraints? So that's how we do it. The way we're able to afford it then becomes, I think, what's so important. And that is actually empowering the consumer with information, letting them know what the quality of a doctor is, know what the price of a doctor is, and when they have abilities to make decisions, have them make decisions with incentives, knowing the trade-offs that they're making.
And can you go a little bit further into that? So how is Sidecar Health offering employer-facing alternative health insurance?
Right, so again, we're a major medical health insurance plan, just like every other kind of major medical health insurance plan, from everything that you care about. What we are different in is in everything that you don't like about your traditional health plan, right? So everything that we do is via our app, right? So we have an app that you can actually see, wait for this, the price of every doctor in the United States is available transparently through our app. So you can actually see what your doctor is going to charge when you're going to go in for planned care. Maybe you need to go see a cardiologist. At the same time, quality ratings. We take outcome-based ratings, appropriateness of care ratings. We put that into the app. And so then we go ahead and tell you, it's like, okay, I know that we define access to care by, when we enter into a particular market, we basically define a benefit amount for anything that you might want to go do in the U.S. healthcare system. And that benefit amount is determined by the commercial rates, what prices you can actually access that for in that local market. And we basically say, okay, if you take that benefit and you want to go to a place that charges more than that benefit, that's your choice. There's no medical reason to do that, but maybe you really like the waiting room at this particular doctor's office. So you'll know ahead of time, and you'll be responsible for paying more than that benefit amount. Likewise, if you decide to go to a doctor that charges less than our benefit amount for that planned service, you get to keep half of that savings that you save. And that changes everything. A simple example is, let's say you're filling your statin, right? So maybe at one name brand pharmacy, and let's pick on anybody, maybe it's going to cost you $40 to fill your prescription there. But maybe if you filled your prescription at a grocery store, you actually get paid $20. And so suddenly it changes how you interact. Suddenly, prescription adherence is very high, so you stay healthier, and that leads to lower cost overall. Does that make it more real?
Absolutely, absolutely. So right now, there's a big focus, I don't know if you ever heard of it, about Make America Healthy Again.
Of course.
It's something that we've heard several times.
Yeah.
And part of that is addressing chronic diseases, things
100%.
like obesity. And what role is Sidecar playing in all of this?
Well, again, I mean, we think some of the core principles around the MAHA is really around access, right? How do you break down access to care? And again, this comes back to why we have no prior authorization. One of our things that we highlight a lot is, like, again, we really put the emphasis on doctors. So if you think about one of the priorities being, how do you shrink the time to get care? With prior authorization, maybe you need to go get an MRI, but because of your health plan, your doctor is saying you need to get a CT scan first to get access to that MRI. Well, that delays care. So we don't do those things. We want doctors making care decisions. We, as a result, by the way, see a much higher utilization of primary care. We see a much higher utilization of mental health care, so 50% higher mental health claims on our plan than others, because we have no constrained networks. You're never on a waiting list to try to go get access to care. So if you think about all of those things together, we're able to actually increase access to care for things where it lowers the cost of care, and this is where it gets to bending the cost curve. Things like emergency room visits, which drive higher cost. We see 45% less emergency room visits on our plan because people are not prevented from getting care. They're not ending up in emergency situations. We see appropriate site of care. Like, let's think about imaging. Like, you don't need to get an MRI at a hospital. You can get the same MRI at a standalone imaging center. That's dramatically less expensive. So by helping people, creating financial incentives for people to make those decisions, it frees up dollars for things that are really important, like preventive medicine.
And when we think of healthcare, we typically think of the doctor-patient relationship. Mm-hmm. But nowadays, more and more, AI has a role in things. And I guess, what role do you see AI playing? And then what are your priorities for AI?
100%. Well, so we don't really have an opinion on AI in terms of care delivery. I think there's lots of questions. I think one of the previous panelists talked a lot about, hey, you want to be really careful about bias. What we think about AI for is actually unlocking the consumer experience. Like, for example, let's say your family has a basket of prescriptions that they're on every month. The way we use AI is to help consumers know, within 5 miles from your house, where is the pharmacy that for your entire basket of prescriptions your family is using, this is the place where you can is the most economical for you, where you get the most cash back. Or if I'm trying to pick a cardiologist, we can use AI to help you identify what all your choices are in a given area, what their prices are, and ultimately like set up an appointment for you. Even beyond that, think about billing. Like a single view of your medical records, you can use AI to go out, integrate with systems, pull them in, and actually have a one view, even though like my specialist might be in a different system, my imaging might be all over. So AI is a huge unlock for consumers, and that's where our focus is.
Do you see AI disrupting the industry?
Well, the word disrupting is really interesting. A lot of people try to kind of pull that into things like, we don't think about disrupting. Let's talk about empowering. So we think about it as empowering, again, consumers, and we believe that the only way to really fix the US healthcare system is empowering consumers, to really break off all these barriers to care that have been put in place to control costs, but really all they're doing is actually preventing people from getting access to care.
And I know in the previous panel, there was talks about Apple Watches,
Yeah.
technology, and I guess talk with me about that landscape, the role of, wearable health tech.
I think anything, again, that increases health literacy is critically important. This comes back to kind of from our model, is we have doctors and patients teaming up on their care. You know, in a traditional legacy model, the payer is pushing themselves in there and controlling what that right path is. So I think wearables do a great job of creating more engagement, which is very consistent with what we think. We want people to be engaged in their healthcare decisions, know what's going on as they're engaging with things that are going to affect their lives. And wearables just gives you more data to make better decisions, which is very aligned to how we think.
Now, this is something I watched a couple of podcasts that you've done.
Uh-oh.
And this was something that's really stood out to me. The company has less than a 1% denial rate for sidecar, and that is far below the industry average, and also has no formulas and step therapy requirements. Now, can you talk about ways that sidecar is removing barriers to accessing healthcare, and how are you making all of that work?
Yeah, no, and that's exactly right, and I appreciate you kind of highlighting that stat. It's actually way below 1%, but marketing won't let me talk about that. Like, our whole view of the world, again, is that doctors are making care decisions, and our job is to make sure they're paid for. And so if you just look at the view from that, if you look at the world from that picture, and again, I go back to my background not being a deep healthcare person. I'm an engineer. I'm trying to work backwards from what do I want care to be for my family, and how do we empower that? And so for us, it's no surprise we have no formularies. It's no surprise we have no prior authorization. It's no surprise that we are having a very low denial rate relative to the industry. Everybody should be working towards that. How we make it work is because of the unlock for consumers. Like, again, I'll just use an imaging example because it's easy. Like, you can literally spend $5,000 for an MRI in one location, or $500 for the exact same MRI on the exact same machine at another location. And if what we do is say, look, I'm going to give you $1,000 to get your MRI, go wherever you want, what are consumers going to do? Well, they're going to look at the quality that they're getting. It's the same. They're going to look at the financial choices. Well, one, I'm going to pay thousands of dollars. The other, I get paid to get care. Well, first of all, I'm going to run out and do that right now because it's going to be helpful for my doctor. I have no steps that I have to go through to get that. And then once I get that information, I can speed care, and that's going to lower the overall cost. That's what we see in the claims data. So that's how we do it.
And I think for myself, even when I go to make an appointment, it can be overwhelming 100%. For me. And I guess you've touched on this in your example, but can you talk a little bit more about how Sidecar Health is empowering consumers when it comes to making decisions?
Yeah, I mean, again, think about everybody's personal experiences. Has anyone here ever received a surprise bill? Yeah, right. So we're trying to avoid that. So like through our app, what you're going to see is you're going to see Dr. Patel. Dr. Patel, if you go see Dr. Patel, you're going to pay $20. And that includes everything that's going to happen in that particular episode of care. Like if you go in and he's a cardiologist and you've got an EKG, you weren't expecting that. How would you know? So all of those things can end up being surprises in a traditional situation, and ours is completely transparent. Likewise, you're going to see their quality ratings, and you're going to say, well, maybe I want to go to this other cardiologist where all that's true, actually, and then I get paid $10. Wow, that's like a negative copay. One of the things that shocks most people as they learn about us, our average family that's on our plan every year gets $1,000 cash back, while not having barriers to care, while their premiums are about 20% lower than what you typically see on a traditional network-based plan because of all the barriers to care. So that's how.
And right now, we've mentioned this several times, but we are in the midst of a shutdown.
Yeah.
And when it comes to lawmakers, when it comes to the administration, what more would you like to see from lawmakers when it comes to healthcare?
Yeah, I mean, for us, it's really about transparency. What can we do from a policy perspective to facilitate increased visibility into what things cost, increased visibility into the quality of doctors? So let's just empower consumers to have all the information that they need to make care decisions, because that is there's no stronger, kind of more efficient market force to create value. And you see it in every industry other than consumers. So anything from a policy perspective we can do to increase the ability for consumers to navigate with their doctors, I think is going to be better for everybody.
Looking ahead, what's the biggest change that you think we'll see in the industry over the next year?
Over the next year is a pretty narrow time frame. I'm hoping we get back to work. For me, again, I think that you're seeing increasing conversations about prior authorization. That's very exciting. So I think there's going to be more and more pressure. I hope we turn that pressure into more action to eliminate a lot of the prior authorization that the system is built on today. And so for me, I'm hopeful that could be solved.
And in that answer alone, I heard you say hope and hopeful.
Yeah.
What are your hopes for the industry moving forward?
Well, every entrepreneur is super optimistic about the future, I think. So my hope might sound a little bit, surprising, but I hope people copy us. Right, so like at the end of the day, every day, our team, this great team, wakes up and we're trying to make healthcare better for everyone. We believe we can lower the cost of care, increase access for everyone. And I think the big change that we need is we need consumers more at the forefront of their care decisions with their doctors. And if all of the traditional players that we all know and love, if they can start copying us more, that's going to move everything. It's going to move policy. That's going to move everything more towards this future where we don't have the same barriers. So I'm hopeful that we get copied.
All right, thank you. Patrick, appreciate your time.
Well, thanks for making the time for me. Appreciate it.
Please welcome Chiquita Brooks-LaSure, former CMS Administrator and Senior Fellow at the Century Foundation, for a Medicare checkup. Please welcome back to the stage, Bree Jackson.
Nice to meet you. Sorry about that. Thank you. I was so used to walking off the stage and going around and picking up my notes. So it's a pleasure to have you here.
Thank you for having me.
So first, just starting off, I guess, tell me a little bit about your thoughts about how everything is going right now when it comes to the healthcare industry, because a big part of this fight that we're seeing is over programs like Medicaid and Medicare when it comes to this fight that we're seeing on Capitol Hill. What are your thoughts on all of this happening right now?
Well, just to take a step back, when we left to office at the beginning of January, I'm incredibly proud of what we were able to accomplish during the 4 years of the Biden administration. We entered this year with the lowest uninsured rate in our nation's history, with having, for the first time, negotiated drug coverage at lower drug costs for the Medicare program for the top 10 drugs. We had states expanding Medicaid. 4 states expanded Medicaid overall, and almost all the states had expanded coverage postpartum. And then just a couple of weeks later, we really had a tremendous fight in Congress about many things, but a big portion of that was healthcare. And $1 trillion was taken out of the healthcare world, which has had some serious ripple effects, even though many of these provisions do not take effect today. And what, over the last couple of months, we have seen across the nation is that the money that is taken out of the Medicaid and the Affordable Care Act coverage is already affecting care in this country. I've been doing a number of meetings and town halls across the country, and we're already seeing rural hospitals who are either talking about not expanding or shutting important services. In Georgia last week, a major hospital system announced that they were closing their labor and delivery wing of their hospital. And we're starting to see already that hospitals and other providers are trying to absorb these changes. States are in the process of really trying to make the changes that they need to their programs. Those of you who work at the state level know that you have an annual budget and you have to think very hard about the changes that are coming down the pike. And so we see a lot of disarray in the healthcare industry and some adjustment about what this is going to mean as a result of this legislation. And then we get to today, which healthcare has become a big part of the fight over the shutdown. And as a former government worker and official, I've been on many sides of a shutdown, worrying about how I would pay my mortgage if the government shut down during the Obama administration, having to make decisions about what a shutdown looks like. And my heart really goes out to so many of the federal workers and contractors, and just what a difficult time this is.
And one thing I think is interesting that I saw that you did, because sometimes the hardest part is getting the message to everyday people that may not be part of the medical field. And I saw that you did an article in the Philadelphia Inquirer, and you wrote that the Republican budget bill that was passed over the summer sends a message to families on Medicaid: you're on your own. Mm-hmm. What do you mean by that?
What I mean is that, we were moving to a place where I believe there was just a real understanding that healthcare is so much at the core of your ability to achieve the American dream: life, liberty, and the pursuit of happiness. If we want our children to get well educated, they need to be healthy. We need to make sure that we are taking care of the seniors in our country. And we need to make sure our providers can make a living and stay open. That benefits all of us. And I think there's just been this year just such an attitude of adding red tape to a process. And most of the conversations I've had with people over this year are, am I going to get coverage? Am I going to be affected? My kid is has learning disabilities and we rely on this care. My kid has this set of services. Are they going to be available to me? And just true panic about what these cuts were going to mean. And this is, a range of families. I don't think people all the time who don't spend all of their space understand how important Medicaid and Affordable Care Act coverage is for our overall economy. I mean, most of the long-term care in this country is actually paid for by the Medicaid program. It's really about, I'm Gen X, we've got aging parents and kids. Like, there's so many people who are in that phase of life where they're thinking about both ends. And Medicaid and ACA coverage really support so many of those families. And so many of the people that, when they want to change their jobs at 50 or 60, before they're Medicare eligible, they want to leave their companies, start something new, you need to buy insurance. Well, it is not necessarily affordable at those ages, and the Affordable Care Act has really been just a tremendous lifeline for so many people who want to start their own businesses, and I've spent the years talking with them.
And I'm going to take a step back for a second, because I feel like we put you on the hot seat the second you sat down. So I'm going to step back a little bit. Talk with me about some of the things you're most proud of from your time at CMS.
Yeah, I really I look back on those years and feel tremendously proud about the work that we did to strengthen the CMS staff. We had a very strong team of officials who came in, and we were able to do a number of things that were incredibly important, strengthening the Medicaid program. So really trying to lift up the rules, the standards, and we've all learned a lot about how difficult it has been over the years to enroll in Medicaid, and so we were marching in a direction of trying to get states to streamline those rules. We learned a lot during the COVID pandemic of what we call unwinding as we started to do eligibility and really trying to lift the rules, not just of getting coverage, but also making sure that coverage is meaningful. So trying to work on improving access to care, because at the end of the day, that's what matters. Maternal health is a particular focus of mine and so many other people in the administration. And so not only getting states to extend coverage postpartum for 12 months, which I think is necessary, not sufficient for addressing postpartum care. Many women, particularly Black and brown women, die after birth. And just really helping to educate people on how important it is to have continuous coverage, important for moms, important for babies. And then prescription drugs is just at the source, I think, of so many families' concern about costs for health. It is not the only level of concern, but in good ways, I think over the last decade, we've seen such jumps and leaps in therapies coming to market. But as a result, I would say people are more dependent on drugs. The number of drugs that the average senior takes is rising, and it is a much bigger part of cost. And changing the benefit of Medicare Part D, the Medicare drug benefit, really is a lifeline. This year, thanks to the work we were able to do with negotiation and changing the benefit, the cap is $2,000. And just the time that I've spent with people across the nation, how important this is, not only for the seniors who take these drugs, but again for their families, you know, of not worrying about how's mom, how's grandmom, how's my aunt gonna pay for her prescription drugs.
And I'm going to come back to drug pricing, but I know several times today we've heard people talk about maternal health. Mm-hmm. So I'd like to dig into that a little bit more. I guess talk with me about some of the concerns that you have and some of the things that you hope to see our country do when it comes to this issue.
Well, what we know from our experts is that something like 2/3 of the maternal deaths are avoidable, and that's a combination of reasons. Sometimes it's women not being listened to, sometimes it's women not getting care. You know, we can't just improve our maternal health outcomes by thinking, like only looking at the delivery, but we know that many, many women die in the delivery room, or again, postpartum, that symptoms are missed. And I really felt during my time that we had a real synergy of private and public interest in addressing that issue. One of the things that we did at CMS with the administration is having increasing our standards on hospitals. And so many private sector companies really partnered with us on that. And I thought it was just an excellent first step of saying, here, we're gonna have a similar set of standards, things that we're gonna make sure that all of our facilities really are paying attention to, and really try to make sure that there is engagement. Again, like we need states to engage, we need the private sector, because the government doesn't deliver babies for the most part. And I'm particularly proud of it because Medicare does not deliver or pay for a lot of the babies in this country, but hospitals and other providers care what Medicare cares about. And so I thought it was just wonderful to be able to use the Medicare program, which it often is, as a way to drive changes in our healthcare system.
And returning to drug pricing, we know last week the Trump administration announced that Pfizer will charge most favored nation pricing to Medicaid and guarantee pricing on newly launched drugs. What's your take on that?
So I think that it is a bipartisan agreement that how much Americans are spending on prescription drugs is too much. There are a whole lot of reasons that we don't have time for and different points of view. So I think it's good that we continue to look for ways to try to make sure that people can get access to the drugs that they need. I think I look at the announcement and I think that is not sustainable for your whole life cycle, right? Like if you're a person and you're taking multiple drugs, you need those drugs, all of them, whatever you're taking, to be priced in a way that you can, where you're able to make sure that you can pay for your health care. So I personally think we still need to look at comprehensive policies to make sure that prescription drugs are affordable, because we all know that we're in a country where innovative drugs come to market, but if people can't actually afford them when they need their care, what's the point? And healthcare costs, prescription drug costs are not sustainable for our various programs.
And with new leadership at CMS in place now, which of your policies are you most concerned about? And what bipartisan areas do you expect to endure?
Well, what I'm mostly concerned about is the coverage. And, you know, I think that H.R. 1 has moved us in completely the opposite direction of putting so much additional red tape that what we have seen time and time again is when you add red tape, people who are eligible lose coverage. This started, you know, the CHIP program, that's how I got started in my healthcare career, where adding more burden on children to prove that they were born in this country led children who were born in this country to lose coverage. And that's one of my biggest concerns, that, and even though these things seem fast, the other thing is, you know, adding more red tape to both to Medicaid and ACA coverage. And I really worry about the health of the marketplaces if we make it so difficult. There's many of the things that we did during our years are what led us to go from 12 million to 24 million. And taking away those things administratively, as well as the changes that have come in legislation, I worry that we'll get back to where we were when we started.
And so now you're with the Century Foundation. Can you talk a little bit about your role there, and then how you hope to make an impact on the industry in that role?
Well, mostly I've been spending so much time talking about all of the things that are happening in healthcare. Who knew, you know, that this would be such a busy year, and how much people really need to understand what's happening. So a lot of what I'm doing is really making sure that people across the country really understand and think about how they can use their voice, because none of these changes are inevitable. They are all decisions, and as more and more people understand the implications, hopefully we will see some changes to some of the policies, and really thinking about what do Democrats look for the future. I think there's so many things that I would have loved for us to be tackling this year. You were talking just a few minutes ago about prior authorization. There is more work to be done to make sure that people have access to care. I would really like us to get back to those topics, and that's what I'll be hoping that we shift to once we get coverage back on track.
Well, thank you for your time today.
Thank you.
Please welcome Julia Manchester back to the stage, joined in conversation by Nancy Brown, CEO of the American Heart Association.
Hi, Nancy. It's so great to join you here today. How's everything going?
It's going well. Thank you so much.
Wonderful, wonderful. You know, you've led the American Heart Association since 2008. Looking back, what's changed most about the fight against heart disease in America?
Yeah. You know, I would say many things that are positive and some things that are of great concern. I want to make sure that the audience is aware that deaths from heart disease, cardiovascular disease, have been cut in half since the founding of the AHA in 1924. And that really has to do with many things, the marvels of scientific innovation, technology, drugs and devices reaching people, you know, procedures. You know, a person who has a stroke today can walk out of the hospital if they get the right access to care. 2 days later, with their life almost back to normal. This is the marvel of scientific innovation, and that is really the foundation of what we stand for at the AHA, and we're very proud of that work. At the same time, people are not as healthy as they need to be, and that is a major focus of the work of the American Heart Association, so a lot of work ahead.
When it comes to heart disease, just if we could have a broad overview, you mentioned people aren't as healthy as they need to be. What factors can go into preventing heart disease?
Well, heart disease is the #1 cause of death in America and around the world, cardiovascular diseases broadly, including stroke. And there are a number of things that really matter. We call them life's essential 8. A person's ability to have access to healthy foods, live a life free of tobacco, get appropriate physical activity, and have a body mass index at an appropriate level, as well as having risk factors controlled: blood pressure, blood cholesterol, blood glucose, and most recently added to get enough sleep. And so it is a basket of things that need to come together for individuals and families that allow a person to have optimal cardiovascular health. And let's face it, the most important thing to a person in their life is their health. Because when you have health, it buys you the ticket to everything else that matters to you. Time with your family, your friends, your faith organization, being a great member of your community, a great employee. All of those things happen when you have good health, and so it really matters.
And we talk about how much it matters, but recently we've seen cuts to NIH funding, some government funding that I understand has affected the American Health Association. Talk about how it's affected, or Heart Association, talk about how it's impacted your job and also, impacted the fight against heart disease.
The NIH is the major funder of research in this country. Of course, we all know that. The major funder of cardiovascular disease, the American Heart Association, is the second largest funder of cardiovascular disease research in America. The cuts are devastating, or the proposed cuts and the actual cuts are devastating. If we think about the strategic advantage the United States has in the area of science and technology, it's very significant, and we're at risk of losing that. Clinical trials that are funded by the NIH, I think Dr. Besser mentioned this earlier, they're at the front end of things that each of us enjoy today. And I think often we don't stop and think about what happens in a healthcare encounter. If someone gets raced to the emergency room having a heart attack or a stroke, there's a team of professionals there that know exactly what to do. There's medications that are administered, blood tests that are given, a troponin test to see if you're having a heart attack. Arteries are opened, strokes are pulled out of your brain with a thrombectomy. People didn't just wake up one day and say, I think we'll go into someone's brain and pull a blood clot out. Years of clinical trials and studies were at the front end of these innovations that people in this country should be so happy they have at their disposal, and we should be so proud that this is a standard of care in this country. The demolishing of scientific research will have a devastating impact on every single one of us today and in the future, and so we're very concerned about it at the AHA.
So how have you been able to pivot over the past 8 months? How have you been able to, I don't know if there's any way to, curtail, work your way around these cuts, but what have you had to do in the meantime?
Well, just for background, the American Heart Association is a global organization. We have a presence in 110 countries. We have 33.5 million volunteers and supporters and 40,000 medical and scientific members that are part of our organization. And as I mentioned, we are the country's second largest funder of research into cardiovascular diseases, including stroke. So we, of course, focus on what we can do with our funding, which, pales in comparison to the NIH funding. And we also make sure that our voice is heard in Washington about why research matters. Research matters to every person, whether they realize it or not. And so we work very hard to bring to life the stories of patients and survivors from young people to old people whose lives have been saved or impacted because of research. It's really important that that not get lost in the narrative. You know, we have people's health and people's lives in our hands here, and we have to remember, you know, a child born with a congenital heart defect today, research is the reason that now we have adults that are living with congenital heart defects that they were born with. These children didn't make it to adulthood 20 years ago. So stories really matter, advocacy really matters, and I think for the American Heart Association, because we are a science organization, we are a policy organization, and we are a grassroots organization, we're uniquely positioned to work together with our partners at Research America and other organizations to make sure that our voice is heard.
I want to switch gears and talk about women's health. Heart disease obviously disproportionately impacts women, particularly women of color. How does the American Heart Association address inequality, systemic inequality when it comes to treatment for women?
Yeah. You know, women should stand up and be really mad about the fact that, first of all, heart disease is the #1 killer of women. It affects more women than the next 4 causes of death combined. People have a mental model of, older men clutching their chest and falling over with heart attacks. The thing to know is that for women over the age of 25, 45% of women already have an established risk of cardiovascular disease. And so it really matters that we do things personally to control our health. Yet systemically, there's a lot going against women. First of all, women are understudied. The symptoms of women are under-recognized in the healthcare system in America today. Women are not enrolled in clinical trials to the same level as men. And what we like to point out is many of the medications, the treatments that are broadly available to people in this country, a large proportion of those studies were done on men, not women. And so we must stand up and be advocates for our own health as women. And at the American Heart Association, that's what we do through the Go Red for Women campaign, a campaign that we launched more than 20 years ago to help women, take action for their own heart and the heart of the sisters that they love. We must get rid of these inequalities. Black women have higher levels of heart disease. Something like CPR administration is really an important thing that we urge everyone to know. You may not be aware that about 350,000 people a year have an out-of-hospital cardiac arrest, and fewer than 10% of those people survive. So through the Nation of Lifesavers campaign at the American Heart Association, we work to fix that problem by making sure that CPR is widely administered. But women should be very upset to know that CPR is administered less in women than in men if in bystander situations, and less in persons of color than white persons in bystander situations.
Why is that? Is that because of a bias?
We assume there's a unconscious bias that could be going on, and there's also just systems of care. We have to make sure we double down in communities where there's a disproportionate risk of heart disease to make sure things like CPR training is widely available, that access to health care is widely available.
Wearable health is a very big topic today. I chatted with Dr. Lauren Chung from Apple. I'm going to chat with Tom Hale from Aura in a few minutes. How does the American Heart Association view wearable health, but also other new technologies like AI? I know wearable health, there's so many preventative health benefits from, wearing one of these devices. How is AHA viewing that?
We have long believed that wearable health technology is a game changer for individuals managing the risk of heart disease and of having a stroke. Way back, I remember when wearable health was just something people were talking about, we created a Center for Health Technology and Innovation at the American Heart Association because we know what really matters is getting gold standard science into wearable technologies so that the devices that people may have access to as consumers are tracking the appropriate things and using the appropriate science. So we are very bullish on wearable technology. One of the things that matters to us is the affordability and access of wearable technology. We want to make sure that wearable technology reaches all people that are, that may be at risk of heart disease or of having a stroke. But we think it's really important. And on the topic of AI, I agree with Dr. Besser's comments. There's a lot to be excited about if AI is implemented ethically and appropriately. We actually recently completed a large study of AI in cardiovascular disease science, research, healthcare delivery, and consumer access. And the ethical use of AI is what really matters. We think about healthcare delivery in AI and how it might administratively help support a more efficient healthcare system. Yay, we need that. There's marvelous technology that is being implemented to actually detect a person's risk for something like valvular heart disease long before they knew they had it, because AI tools and algorithms can study blood tests and imaging tests and highlight to healthcare providers people who might be at risk for certain cardiovascular conditions. That's amazing, because if we can get at the front of it and help these people have access to the right technologies to manage their disease they may not have known they even had, that can be a game changer in technology and healthcare delivery as well.
We're here in Washington today, obviously. What policies or what areas would you like Congress to address in order to reduce cardiovascular deaths?
Well, number one on the list is access to high-quality health care for all. We have heard many of our speakers earlier today speak about the fact that if we limit access to people, we will pay a consequence for that. People in rural America, persons in communities that perhaps don't have access to high-quality employer-sponsored health care, as examples, their health risks can increase, and that really matters. The NIH research we've spoken about already. I was very happy to hear the senator speak about food as medicine programs. The American Heart Association has fought for healthful food programs for decades. And as a matter of fact, right now, we and the Rockefeller Foundation have a large food as medicine program where we seek to create the definitive evidence to prove that food as medicine programs, when implemented for certain populations in certain environments, can actually improve health outcomes and reduce costs. And it's really a behavioral economics approach to food as medicine programs. We're very excited about these, and we believe that implementing them can help more people have access to healthful food products, which is a real rate-limiting step for the health of individuals in this country, is access to healthy food products.
We only have a few minutes left, but we started on a positive note. You mentioned that since the American Heart Association was founded, the cardiovascular deaths have been cut in half. What are you most hopeful for going forward?
I'm hopeful that we can continue to inspire people to care about their health and to understand that so much of a person's health is in their hands. What we eat, how we get physical activity, those things really matter. Social connection to people, getting enough sleep, these are things that matter. Yet at the same time, there's a lot to change in the environment, because access to healthy food isn't the same for all of us. Safe places to exercise and play are not available to all of us. So I think as individuals and as organizations, we must continue to be the voice for the voiceless and make sure that we are creating public policies that allow health and well-being to be something that can be enjoyed by all.
Nancy Brown, thank you so much for joining us today.
Thank you so much.
Appreciate it.
Thank you.
Now joining Julia, please welcome Tom Hale, CEO at Aura.
Hey, Tom.
Hey,
good to see
how you
you.
Thanks for having me.
Thanks for joining me. Now, before we get started, Tom and the folks at Aura were gracious enough to lend me an Aura ring that I've worn over the past few days so I could see how it works firsthand. So before we get into that, I just want to, for the folks in here who aren't as familiar with Aura, what's the mission of the company?
Yeah, so we're a supremely mission-driven company that's driven around the idea of improving the world's health. The way we do this is by making health a daily practice. We give you the information, the guidance, the education to change your behaviors, to create long-term better health outcomes. And the way we do that is primarily through a wearable. It is different from most wearables in that it's measuring from the point which is the most accurate on the human body. You might say, oh, that's interesting, but think about it. Who's been to a hospital? Where do they put the sensor? Do they put the sensor on the back of your wrist where there's bone and sinew and hair and all these confounding factors? No, they put it on the tip of your finger. Why? Because arterial blood flow, uniform tissue, and the sensors being proximate give you the most amount of information. So we're a little different from most. We're probably more grounded in science, more grounded in the science of behavior change and the science of measuring. We started with sleep. For those of you who know the Oura Ring, started in sleep. But that was our strategy because we know that measuring at night gives us a really clean signal on the human's body. And that way we can make comparisons night over night about small changes in your physiology measured in a very clean way and start to make inferences about how your health is trending or changing. And I think, we'll talk about it later, but one of the things that we can do quite effectively is predict the onset of influenza-like illness. We can see that 2 or 3 days before you actually have symptoms, which is no mean trick. So the other things that we did after sleep, we said we know we want to do health. We've expanded kind of the surface of health to include women's health. We can make predictions about your cycle. We can make predictions about when your fertile window is and be accurate within half a day. We make a lot of work around metabolic health. We've tracked 10 million meals in the last 4 months, and we start to see those outcomes and how they relate to things like I'm wearing a blood sugar sensor right now, a Dexcom sensor. So we can see the correlations between your behaviors and the outcomes that are happening on a very kind of like continuous way. And that continuity is important. It's actually a set of data that actually hasn't existed before, hasn't even been studied. Now, if you think about the sample rate of our typical today's medical science, is generally expressed over years or a visit to a doctor or a blood pressure, cuff that you put on. The reality is that you start paying attention to this when you're sick. And our mission is to do that before you're sick and start to give you input, feedback, guidance, education before you get sick. So it's all about preventative health and personalization. Stop there.
Yeah, and anecdotally, yesterday, I started to feel maybe the onset of a cold, potentially. I wasn't sure. I wasn't feeling 100%. So I kind of looked at my metrics, my recovery score from previous night's sleep, which was 5 hours sleep. I know, not great. I went to bed early, and then it was much higher today, and I feel a lot better. I think when I talk about Aura, when I hear about Aura, a lot of it's about that recovery score, the sleep, but also fitness. Yeah. I mean, I didn't know that it tracks steps, for example, or I do a lot of Orange Theory. It'll pick up on when my heart rate's going up, and it's like, oh, it seems like you're working out right now. Can you confirm this? Talk about that.
Well, I mean, these are sort of, I think, the stock and trade of all wearables. In fact, most wearables started in fitness, and it's a sort of a well-known and accepted scientific fact that if you put a wearable on somebody, they will move more. The question is, can you sustain that behavior change? Can you really see an impact on someone's behavior over the long term? And reality, and I think anybody who's signed up for a gym knows this, fitness is actually a relatively churny activity. You kind of get into it for a while, and then you kind of fall out of it. And I think one of the things that we really try and seek is to give people both visibility to how they're changing over the long term, to give them the motivation, and maybe even a little bit of support. Many wearables sort of take the posture of like, you didn't get your steps in today, you get off the couch, you lazy bum. And I think Aura, maybe uniquely in the wearable space, is very much about supporting you through your health journey, saying, hey, you know what? Maybe today wasn't a day for you to go for it, but maybe try tomorrow. And that kind of tonality has, I think, been part of the secret of the success.
Another interesting part about Aura is the advisor, the AI advisor that comes with the app. I've asked it questions. It's given me good feedback. What is the feedback you've received?
I think stepping back, if you presume that we have a shortage of primary care physicians, in the world, and we're actually relatively advantaged relative to the rest of the world. We're doing really well. We don't have enough. We've probably 250,000 primary care physicians, in America today. If you give them 2,000 hours of care, that's about 500 million hours. That's maybe an hour and a half for each man, woman, and child in the United States. Not enough to change preventative behaviors and care. So the idea of an AI that is like super knowledgeable about you, very empathic, knows what medicine would say is the right thing to do, and is able to provide that intervention is a very strong motivational change. We have some interesting stats. We rolled this out about maybe almost a year ago. So first of all, women use it twice as often as men and for twice as long. That's interesting. We're skewed towards women in our customer base, but it's really pronounced. And then the second thing, what do they ask about? Well, they ask about fitness. They're saying, what should I do? What can I do? But they also ask a lot about health topics. Mm-hmm. And the third thing is we were trying to figure out why it was skewed this way. And we went to them and we said, why is it? Why is it that you spend more time in it? And they said, well, it knows me really well. It remembers things about me. It asks me questions. It's very empathic, and it's very patient. And what they were really saying was that here was sort of a kind of a health companion that was there to help them on their health journey through a wide range of parts of their life. It wasn't just any one thing. And we said, well, that's interesting. What features would you have us add for it? And they said, we want you to be able to give us the ability to name it, which I took to be really interesting, because what it said was actually it was about a relationship they were having.
Yeah.
And by the way, I think this is now well documented in sort of AI, is that like part of the appeal of an AI nurse or doctor is that it has infinite patience. Yeah. It has infinite empathy. It actually is there. It's not going to be like, when I got to get home, my cat hasn't been fed, I had a bad night last night. It's just very much a supportive entity. So we're sort of learning about this, and I do think that kind of like, call it the doctor in your pocket, I think it is the way of the future. It's not going to replace doctors. And if anybody's a doctor, like, your job is safe. Don't worry about it. But the idea that you could have someone who is, monitoring your body 24/7, you already have a supercomputer. You carry it with you everywhere. And there could be some machine intelligence which is looking over all the information, your context, your biometrics, your biomarkers, your health records, and making sense of that in a way so that when you do see the doctor, it's much more efficient, it's much more effective, and you're actually coming with something that maybe gives you more agency in your healthcare journey.
What has the feedback been from human, non-AI doctors in the medical community? I imagine that this maybe could make their job easier, especially with preventative health?
I think it depends. It depends on the doctor, it depends on when they were trained, it depends on what kind of person they are. We get some doctors who say, you know what, I don't need more information. I can, meet it with a patient, and I understand what's going on with them, and I don't need it. This is just wasting my time. Mm-hmm. And, they don't have time to waste, let's be clear. There are other doctors who are thinking more proactively or preventative, or maybe in different domains. If you're trying to solve someone's POTS, which is postural orthopedic tachycardia, it's a long-tail chronic illness. And for Aura, actually, roughly a quarter of our customers use this product to help them manage a long-tail chronic illness. So we have a lot of patients like this. For them, that data is priceless. It's how they manage their day. It's how the doctor knows how to support them. And that data is like filling a gap, because you know what pharmaceutical and surgical interventions don't do? They don't help you with POTS, right? So you have to manage the illness. And I think in that world, those doctors, they're like, I met a doctor at a conference recently, and he said, yeah, every clinic, any POTS clinic in the United States hands out an Aura Ring for just that reason.
So the Aura Ring is collecting a lot of data from individuals, not only health data, but it's connected to your phone, there's a subscription component, et cetera. How are you ensuring that this data stays private?
So I think data for us is a non-negotiable. We think of ourselves as like a clinical type organization. We're actually sort of adherent to both GDPR but also HIPAA in terms of data standards and privacy. Our relationship is directly with the member. One of the reasons why you pay a subscription is so that we have no incentive to take your data and try and make some money out of it elsewhere. We are doing it to protect you and protect your privacy. We do think in the future there will be needs or requests for people to access your data, And our theory on this is that you should be the sovereign of that. You should make that decision. If you want to participate in a study and raise your hand, great, we'll let you do that. We'll support you in that. Oh, you want to share with this app because this app is the best thing for POTS or for long COVID or ME/CFS, great, we will share that data. And you can be the governor of that. We are not in the business of sharing or moving your data around. In fact, we view it as almost like a sacred kind of relationship that we have with our customers, which is that you are entrusting us with this incredibly intimate data. For example, women's health data. Super, super intimate, really important to keep private and keep controlled. So that is the approach that we take, and I think in many ways, I think it's non-negotiable for us.
I asked Dr. Lauren Chung from Apple the same question, but we're here in Washington. What would you like to see lawmakers, maybe the health advocacy world, address when it comes to digital or wearable health?
It's funny, a lot of the speakers up here have talked about access. And I've been following along, so I did a little research with my team, and I said, well, what's the distribution of household incomes for Aura? And they said, well, wouldn't be surprised. There's a lot of the healthy, wealthy, or the worried well. They call them, maybe half of our folks have incomes over 100,000. But 11% have incomes under 50,000, which I was shocked by. This was not a number that I expected to see today. So I think access is one of the most important things we can do. We approach this by trying to find ways to get subsidization through HSA, FSA. We think ICRAs are going to be important. Basically, the employer has an obligation to the employee, and subsidizing this kind of technology is very helpful in moving access forward. But that is not enough. It is necessary and not sufficient. I do think the government has a role to play here, whether that's through vouchers or through reimbursement for certain indications or some other mechanism, tax breaks, rebates, however you want to think about it. I think they do have an obligation to do that. And I think in our world, what we would like to see is a qualifier around the type of medical device that is maybe not a stent, which, by the way, the risk of a failure in a stent is life, ending, and maybe not a snake oil supplement, which has no scientific evidence, but somewhere in between, that's on this side of the clinical kind of wellness divide, but is not necessarily as life-threatening as like a pacemaker. And if there was some way to make that access both supported from reimbursement or however you want to think about the mechanism of funding it, but you also have this kind of quality guarantee from a regulatory standpoint, which is not so high that you can't innovate, but is not so low that you end up with something that's not effective or safe.
What is one feature of Aura for a first-time user like me or someone who's interested in investing in a ring that you would suggest they check out, maybe a feature that we haven't talked about yet on stage?
Well, I think there's a lot. I'm a big fan of metabolic stuff, so I think we have a huge problem in this country around metabolic health. We certainly have talked about the need for foods, medicine, but I think sort of educating people about this. So for me, this morning I ate my breakfast. I took a photo of my breakfast, and the app immediately sort of gave me some feedback on how my eating. And it wasn't like, here's the calories, because that's impossible. By the way, if anybody tells you that they can take a photo of your food and give you calories, that is absolute bullshit. Yeah. Okay, now. If what it's trying to do is trying to teach you about what foods you should eat. It's a really interesting kind of mechanism to modify behavior, because we think of ourselves not as like just a reporter of the facts, but we're trying to change behaviors. So the other one, and we'll take yours for example, is illness detection. So we track 4 of the 5 vitals. So it's oxygenation, temperature, respiration, resting heart rate, and we do it overnight. So we have a really clean signal on it. We will have hypertension and blood pressure. It's not, we're working through the regulatory pathways on that now, but those are the 5 vitals. And when we see a deviation from your baseline in those vitals, we make a little message that says, hey, you've got minor signs, or some cases, if you've really been, pressing your health, you might have major signs. And that feature is so powerful, because what it does is it gives you a heads up that if you don't sort of change your behavior, you're probably heading towards some kind of, influenza-like illness, a cold, a flu, a virus, whatever it is, something that's activated your immune response. And so changing your behavior can sometimes really actually change the trajectory of that illness. And I experience this because I travel all the time, and when I get strained or stressed, I will listen to my app and I will change my behavior, and I will be able to get through the day. I'll drink some tea and lie in my hotel bed for 5 hours, and I'll be fine, and I'll make it through the rest of the trip. So those 2 I think I would really highlight. We could talk about women's health too. It's a pretty fascinating topic. People are always stopping me in airports when they see my Aura outfit or whatever I'm wearing that says Aura. They're like, oh, hey, I love my Aura ring. Aura got me pregnant. And I'm like, I'm not sure that's how that works. But yes, I understand. We helped you, find your fertile window, and in so doing, maybe we reduced a cycle of IVF to, a fewer times, save you some money, save you some time.
Absolutely. Well, Tom Hale, thank you so much for joining me
Thank you,
today. I could
Julia.
talk about this
Thank you.
forever.
Thank you.
Thank you.
Please welcome Vani Hari, founder of Truvani and better known as the Food Babe, in conversation with Bree Jackson.
So far away. Well, Vani, thank you for being here.
Thank you.
I'd like to thank you for the bars that were outside. They were quite delicious. We were talking about this a little bit before, just so that the audience knows. All the bars are good, but do you have a favorite flavor?
Yes, it is the cherry chocolate. And there's an ongoing debate within the Truvani team about which one's the best, because they're all very good.
They were good. They were good. So, well, thank you for those. So just to kind of start things off, can you share a little bit about your journey, how you got into this, how you became the Food Babe? Talk with me a little bit about this.
Sure. I grew up with two immigrant Indian parents that came here to the United States in the 1960s. My dad went back to have an arranged marriage with my mom. And when they got here, the first thing my dad introduced my mom to was a McDonald's hamburger. He said, if we're gonna live in America, we're gonna eat like Americans. And that's how I was raised, on processed fast food. And as a result, I suffered a lot of health issues as a child. I was in and out of the doctor's offices. My parents took me to the doctor because they wanted to find, solutions to all of my ailments, and no doctor asked me what I was eating. They just put me on a medication. And by my early 20s, I'd had 2 abdominal surgeries, was on 9 prescription drugs, and hit rock bottom. And it was, when my appendix was getting taken out, that I made the decision to finally take control of my health and look into what I was eating, what caused me to be in this situation, and to feel this bad in my early 20s when I saw my friends and other people out there, living life. And I wanted to do that. And I started to channel this energy that I learned in debate in high school, where I was a top-tier debater, got recruited to college being a debate, was #1 in the state. And back then, we didn't have Google, so you had to actually go to the law library and look at the journals and pull out the microfiche and do all of that and photocopy evidence. You didn't have an iPad or anything, so you had to take these huge tubs of evidence to different debate rounds. And I remember one year's topic was healthcare. And I was using that information in high school to win debate rounds. I wasn't using it towards my health, though, but I just remember how screwed up the healthcare system was and how so many people were sick. And so I kind of started there and started to research what I'd been eating and what specifically were the ingredients in the food that I was eating. Every day after I would leave work, I would eat a Chick-fil-A sandwich, thinking that it was 350 calories. It has all this protein. It's good for me, looking at the macronutrition in it, not really looking at the ingredients. But when I looked at the ingredients, I was horrified and couldn't believe that there were so many different chemicals in it. One of the first chemicals in it, namely being MSG, which they feed to rats in obesity studies to keep them fat. So I started to make this connection to the food that I was eating and the way my body was feeling. And when I made the commitment to remove all processed foods from my diet and just go to whole, real, natural food, everything changed. I went off every single prescription drug, realized a life that I never thought was possible. And the people around me started to ask questions of like, hey, what are you doing that's different? You look completely different. You have a new aura about you. You have new energy. And so I told them what I was discovering, and I actually just couldn't shut up about it. And anytime, I'd go to a restaurant with my coworkers or with my friends, my close friends and family, I'd ask specific questions. There was like, why are you always asking these questions about where this meat comes from or what the ingredients are in this? And And I told them, this is the secret. This is the secret to having everlasting health, to know what you're eating. And they, I went on a trip to Chicago with a couple girlfriends of mine, and they had an intervention, and they said, you need to join Facebook so you can share your recipes with us. And I'd never been on social media to that point because I thought I wanted to run for office one day. I still don't want to run for office, but I did at the time. And so I decided that I would join Facebook and start building a community. And then that's when Food Babe started. I wanted to call the blog eathealthyliveforever.com. My husband, who's the tech geek in the family, thought that was a terrible name and said to me, how about Food Babe, about 10 minutes later. And I said, wow, that's catchy, that's cute. But I felt a little bit foreign calling myself the Food Babe because for so long I felt so bad in this body. And I called my best friend. I'm like, what do you think about this name? And she said, hey, that's amazing. That describes you perfectly. And I said, no. It's not about me being the Food Babe. It's about teaching people how to become the Food Babe. And because I was working in a high-level job for C-level executives at the big banks, that was my career, I hid behind this name, Food Babe, and never even signed my name, Vonnie, for the first year and a half on my blog. But I shortly wasn't able to hide any longer because when I started writing about the food industry and what I was discovering and the investigations I was doing into the ingredients that so many people thought were actually healthy, like Subway, Eat Fresh, that slogan just rings through my head even today of how many Subway sandwiches I slung across my desk while working in corporate America, which I'm sure many of you have eaten in your lifetime as well. I think about all of the marketing terms we've been told in food and what's actually behind the label and what's really in the ingredients. And that's what Food Babe was about, was investigating what's actually in the food and how to give your body as much real whole foods as possible.
And so it sounds like by becoming more interested in what were the food labels, what's in your food, you've changed your life, but you've also affected a lot of change when it comes to some major companies, Starbucks, Subway, Kraft. What are your biggest takeaways from going head to head with these major companies, and how can you apply, or what can be applied to the food landscape today?
Yeah, so when I wrote this article called Chemical Filet or Chick-fil-A, it went viral to the point where Chick-fil-A invited me to their headquarters, and I was suddenly taking off work from my banking job to now going to the food industry to help consult on new changes. And when I started doing that, I realized that my banking job was no longer my mission. It was really to change the food industry. So shortly after that meeting, which ended up resulting in the fact that Chick-fil-A removed artificial food dyes, removed TBHQ, went antibiotic-free, did a lot of amazing things after that meeting, I decided to quit my job. And suddenly, I had no salary, I had no 401k. I definitely did not tell my Indian parents that I had quit my job cold turkey. And I was sitting in my 2-bedroom apartment in downtown Charlotte, North Carolina, amongst all the financial institutions that I was working at, and saw, the guy with the khaki pants and the blue shirt, kind of like the guy back there, walking around, going to work. Suddenly, I didn't have a job, and I had all this free time to really investigate the food industry. And there was one thing that was really apparent in my travels, and we were just talking, you've just gone overseas, and so you've probably felt this too, but when I would go overseas, I always felt better. I didn't have all of the issues that I had to worry about in America in terms of avoiding chemical ingredients. And I started this investigation into comparing American products to those sold in other countries, the exact same products. So for example, Quaker oatmeal here in the United States, the strawberry and creams little packs of Quaker oatmeal had artificially dyed apple bits made with petroleum-based red number 40. But in the UK, they were using real strawberries. that was one example of the exact same product being sold in 2 different countries, but totally different ingredient lists. The same was true with McDonald's, how there was 11 ingredients, actually it was 17 at the time, 17 different ingredients in McDonald's French fries here in the United States, where it was just 3 in the UK: potatoes, dextrose, and a little oil and salt. It was an optional ingredient. Actually, it's a 4th ingredient, but it was optional. There were other examples, like Kraft macaroni and cheese. Here in the United States, they were using artificial food dyes, yellow 5 and yellow 6, but in other countries, they're using paprika and beta-carotene. And these side-by-side comparisons maddened me. And it was the result of the fact that we've allowed corporations to put profit over people and put profit over health. And when I looked at the health trajectory of the chronic disease rates in this country, and at the top of that blog post that I wrote in 2013, I said that the rates, I was like, this many people have cancer, this is how many people have diabetes, this is how many people have heart disease. And I was just like, why aren't we looking at the root cause of why we are so sick here in America compared to all of these other developing nations? Why do we have the worst health outcomes? And I go, well, here's one thing we need to change, right? That our American food system is systematically poisoning us with ingredients they don't use in other countries. And here are the examples, in Oreos, in McDonald's, and Kraft, and Quaker Oats, and things that people consume every single day. And so I decided to take on Kraft and start a petition. And I got 387,000 signatures on my petition to have them remove artificial food dyes. And when I went to their headquarters, they basically told me to get lost. But they did meet with me, and they told me we have to agree to disagree. But what changed, and what was so beautiful, and this is a really important lesson because it's what's happening right now with the Make America Healthy Again movement, is so many parents became aware of Kraft's competitor, Annie's, who was making macaroni and cheese without artificial food dyes. And Kraft was losing market share. They slowly started to lose market share, and it was gaining with Annie's. And when General Mills bought Annie's for $800 million shortly thereafter, they had no choice but to make Kraft macaroni and cheese without artificial food dyes like they did in other countries.
Well, and I was going to get to this later because I was fascinated by your story, but another thing that people are fascinated by is that you used to be a Democrat, and now you've become a representative of the Make America Healthy Again movement. And how do you, or why do you think, in some ways, nutrition has become politicized?
Yeah, well, it shouldn't be, because every time we make it about being a Democrat or Republican, the chemical companies win. The food companies win that are poisoning us. And so, for me, I was overjoyed that someone like President Trump and Secretary Kennedy got together and made a commitment to talk about these issues on the national stage. This has never happened before in history. One whole side of the political spectrum has largely been mute to these ideas. And suddenly we had a national conversation opening up where people on both sides of the aisle of all political spectrums are talking about something that is fundamental to the way we're all living. You know, a child who is sick doesn't care if you're Democrat or Republican. I can tell you the way I used to feel when I was on 9 prescription drugs. I didn't give a crap about politics, right? All I wanted to do was get better. And without life, without health, I truly think you have nothing. And I've been in that situation, and I know it. And so for me to be part of this fight in this way is really a testament to finally my voice being heard. Because for so long, for decades, I was censored with this information. I think about, and with all due respect, I say this, Dr. Richard Besser, who was here earlier today, being interviewed in 2013 on Good Morning America when they covered my Kraft campaign, guess who said artificial food dyes was safe? It was him, right? And that's what we're up against, okay? That's the kind of opposition we're up against, where doctors are not intellectually honest about how these chemicals are poisoning us.
And I'll let Dr. Besser, unfortunately he's not here to respond.
Yeah, can respond.
But I guess, because I guess for some people, a movement like this would come, when we talk about a movement like this, some will say, well, Michelle Obama tried to do this years ago. And I guess, what do you think the difference is between with what Michelle Obama was trying to do versus the MAHA movement?
Yeah, I mean, I really applaud what Michelle tried to do. I thought it was amazing to have an organic garden at the White House. Like, oh my gosh, incredible. You know, I was a delegate for her husband 2 terms. So I was really pumped about what she was doing there. But what happened is the emphasis slowly started to shift off food and go to movement. And it was largely being driven by the sugar industry, which is largely driven by Coca-Cola and Pepsi and the American Beverage Association. And they basically, paid Harvard scientists to say that it's not the food that you eat, it's the lack of exercise that's making us so sick and fat and overweight and diabetic, and took the emphasis off sugar. And because she wasn't in a leadership position like today, Secretary Kennedy, being the head of the largest bureaucracy in Washington, she largely didn't have the power to stand up to those corporate influence. And I think what's so beautiful to watch and what's happened just in the last short 8 months is the stand up to corporate influence. I finally feel like the government isn't scared to tell the truth about what's happening. When I was, which was monumental to have this opportunity, had the opportunity to speak at HHS with Secretary Kennedy and Dr. Marty Makary, the head of the FDA, when they made the announcement that they were going to ask the food companies to remove artificial food dyes. And I heard the words coming out of Secretary Kennedy's mouth that sugar's poison. I heard the words from Dr. Marty Makary that these artificial food dyes pose health risks. They put a line in the sand right then and there saying no longer can the food companies hide behind this cloak of, these ingredients are considered safe any longer. It was the truth coming out from our government agencies for the first time in history, whereas no other administration was brave enough to do it. It took 30 years to ban one red dye that was allowed in cosmetics. Was banned in cosmetics. You couldn't use it in your lipstick, but it was still allowed in food because the maraschino cherry industry lobbied with the alcohol industry to keep it in food. And it took 30 years to just ban that one dye. Just in a few short months of being in office, Secretary Kennedy has gotten more than 50% of the food industry to remove artificial food dyes and make the commitment by 2007. That's the power of a movement. That's the power of the truth and the information getting out to the American public so they can drive the marketplace towards these decisions and get these food companies to change. And it's one of the reasons why I've never wanted to work in government, because it's so slow, right? Because imagine if he had done the other way, which is, get the FDA to look at, and they're still going to do stuff. I know they're going to look at the rulemaking and other things and look at the post-market scientific review of these chemicals. But imagine if, we waited around for the FDA to do public comment and go through all the rigorous safety studies and the science. And even though all of these other countries, Australia, Canada, all of Europe, India, China, don't use a lot of these dyes that we're using in the same products that they sell here in the United States. And the fact that these American food companies already have the formulation, it's not like they have to reinvent the wheel. And so one of the things that maddens me more than anything is when I see companies like PepsiCo go in the Wall Street Journal or, in the New York Times or wherever they're talking about their products and say, it's going to take us a long time to find the right color for Doritos and Cheetos. You already do it for other countries, right? We understand there's got to be supply chain involved, and I know we have to grow the beets and the carrots that are going to make the natural dyes. But you already have, this is a time for transparency. Consumers want transparency more than ever. Elizabeth Vargas on News Nation just said that to me. Over 60% of Americans are now looking at ingredient labels and transparency because of this movement. It's incredible.
Well, and we're running short on time, but I'm glad you brought that up, because for some people it's hard. It's hard to understand the labels. It's hard to make the change. what's one food swap that you can say today to hopefully help the people watching, the people in the audience, a food swap that they can do today that can help them moving forward?
Yeah, so I just think about something I eat every day, which is oatmeal. And instead of going to Quaker Oats, which is unfortunately contaminated with glyphosate, because it's a conventional oat, it's sprayed with glyphosate right before harvest, I would go to an organic oat and find one that maybe tests for glyphosate. There's a great company, I'm not affiliated with them, called 1 Degree that makes a steel cut oat. And then I use a crock pot every night. It takes me less than 30 seconds to put water and steel cut oats in this crock pot, and it's ready first thing in the morning. It's hot, it's creamy, it's the best texture. It's so good. And it's the thing that my kids gravitate to first thing in the morning. They get a bowl of oatmeal with fruit and berries, you know, and it buys me a little bit of time to enjoy a sip of coffee. So, yeah.
All right, well, perfect. Well, thank you so much for the informative and passionate discussion. Thank you.
Thank you.
It was really good. Thank you.
That brings us to the end of today's program. Thank you to all of our speakers this morning, to our sponsors ByHeart and Susan G. Komen for The Cure, and to all of you who joined us in the room today, as well as the thousands who joined us online. If you missed any portion of today's event, the full event video is available on thehill.com. Thank you and have a great day.